Interpretation devices are available at the entrance of the auditorium.
Disponíveis na entrada do auditório. I want
Senhoras e senhores,
Ladies and gentlemen, good morning. You're welcome to the second day of the Global Conference on Climate and Health. Our plenary today starts with the second session, Learning with the Experience. And please remember to keep your devices in silent mode. We now invite to the stage Ellen Yaxley from the Ministry of Foreign Business of the British Community and Ministry of Development of the United Kingdom. To open the session, while we wait for Ellie Yaxley, we invite Elena Villalobos-Prates from WHO ATACH to present to us an update of the national plans of adaptation for health and determine national confirmations. After Elena Villalobos-Prates, we will have two round tables. The first one with the Ministries of Health, moderated by Carolyn Dateshi from the Ministry of Health of Canada. Carolyn, would you please join the table too on stage? Ellie Yaxley, welcome to the stage during this important occasion. The speakers include representatives from Fiji, Senegal, United Arab Emirates, Germany, Bahamas, and Bangladesh. I invite all of those mentioned to join us on stage. The Roundtable 2 will have the participation of members from TAT and will be moderated by Gerald Imba, representative of France. The speakers in the second roundtable will include representatives of the Global Fund Doctors for the Environment from the HCAN Development Network, AstraZeneca, SME, Zenoth, SME, PAHO, and Columbia University. I pass the floor to Elena Prates to open the first session. Thank you very much.
I would like to project that will give a little bit of an introduction on where we are with the ATACH, progress made to date, country priorities, and also give a snapshot of some assessments that WHO has done looking at the NAPs, the HNAPs, and the NDCs and how health is integrated there. So if we can have my presentation, please. You will see while we get the slides. ¿Cómo que funciona? ¿Só isso? O verde? Tá. Perfect. So we have the slides. I think this slide, everybody knows it. It gives kind of a historic representation of how things have evolved in terms of climate change and health, and how everything started to change in 2021 with the UK as president of COP26. They were the first presidency to launch initiatives specific to health. So basically, we were working very closely with them and other partners like Healthcare Without Harm. And by the time of the COP26, we got 50 countries committing to building climate resilient and low carbon sustainable health systems at the Minister of Health level. Then, since we were a little bit shocked by the success and the interest by countries to these initiatives, we decided together with the UK to form the ATACH. The leadership that the UK show was continued by Egypt in COP27, where they launched this initiative on climate action and nutrition, the ICAM, that we decided also to host as part of the ATACH now. COP28 continued this leadership and even increased the visibility that health has ever had in one COP. We had the first ever Health Day. We also have the financing principles that were launched by the COP28 presidency. And as part of, they also managed to get a declaration on climate change and health that as of now has been signed by over 150 countries. This declaration includes too many important priorities, including, for example, climate-informed early warning systems, One Health, health workforce, and so on. And then in May 24 and 25, we managed to pass the WHO resolution on climate change and health, and in 25, the Global Action Plan on climate change and health, which may be advanced and contextualized in some specific regions, like, for example, EMRO. And then we also had COP29 with, they decided not to launch any specific new initiative, but this process and mechanism by which all the presidencies that have been leading health throughout the UNFCCC process basically come together under this presidency's continuity coalition to try and make sure that health continues to be promoted as a priority within the negotiations and the COPs. Now we are working very closely with Brazil, and basically we here are working with them to ensure that the Belém Health Action Plan is advanced, that it integrates the priorities by all of the countries, by all of the regions, and is further advanced basically to be launched at COP30 and get these voluntary commitments that they are expecting to get from countries. And we heard yesterday that already some countries are committing to implement this because they feel that those priorities are fully aligned with their national priorities. I thought it's important to reflect in the point that Maria Neira was making yesterday. There is full alignment on the priorities that are integrated in many of these key milestones. For example, COP26 was already mentioning climate resilient and low carbon sustainable health systems and had specific commitments, very narrow and very specific, but as the basis to advance the overall climate resilience. And this climate resilience is, again, integrated in the COP28, in the COP30, and basically, of course, in WHO plan and resolution. I will not go into too many details with this, basically just regarding the governance mechanism, for us the most important is countries. So now we have 95 countries that have committed to do more on climate change and health. And basically they are represented in the steering group, one country per each of the WHO regions. Then we have the co-conveners, who is UK and WHO as the founding partners of the ATACH, and then different co-presidencies. At the moment, we have Azerbaijan and also Brazil. And then, of course, then we have different constituencies represented in the steering committee. We have NDBs, we have civil society organizations, we have worker health organizations, research institutions, and really we are trying to make sure that we find the mechanism, and it's a constant work to do, by which these constituencies are empowered to really do more and contribute more in advancing this agenda. The scope continues to be health systems. This is the priority focus that we have, including supply chain, both resilience and low carbon sustainability, but also making sure that we work with other sectors and help them to define and promote health-promoting interventions in those sectors. And the ICANN is a very good example, and we hope to learn more with this ICANN and the partners that are leading the ICANN to inform how we can work with other sectors to do the same. You see the functions there. Finance is a key priority, so could be included also under the scope, but basically all of the functions that you see there are very important. In terms of operational mechanisms, the ATACH now has mainly task teams, and task teams is a deliverable. So basically we hear from countries, they tell us, I need a tool, I need capacity building, I need more guidance on how to conduct assessments. So this for us is a task team. And then we reach out to partners and try to identify who is best placed to lead the development of this specific output in collaboration with all those that are interested in contributing to that. Then we have, of course, technical meetings, so it's quite open. There are certain criteria for partners or countries to organize one of these technical meetings. Like, for example, collaboration, it has to be done among different partners, has to be requested by countries. And this is probably the entry point to advancing more in a specific area of work. And then, of course, we have the online community of practice and the global community of practice that basically meetings like this are allowing everybody to enter into contact, to create partnerships, to learn more, and basically to come together to advance the goals of the ATACH that we are all sharing. This is just a slide, again, what do we mean by health systems? When we talk about climate resilient health systems, low carbon sustainable health systems, it's a quite comprehensive approach, and again, it's very aligned with the priorities that Brazil is promoting, because you have there, the quality is a little bit bad, but under information systems, you have integrated climate and health surveillance systems, you have early warning systems, you have healthcare facilities, supply chain, health workforce with all the, and policy and leadership. So evidence-based, innovation, supply chain, research, everything is there. And it is very important that we don't lose this comprehensive approach to strengthening health systems. Again, I will not go into details, just to acknowledge the leadership and the work that is being led by all these partners. So UNDP, NHS England, Lancet Countdown, ICANN, EGID, FAO, World Bank, the Commonwealth Secretariat, again the World Bank, because they are leading some of these key deliverables and products that the countries are prioritizing and they want to see advance. The same with technical meetings, just to acknowledge, there are many, to acknowledge the work that is behind all this. Healthcare Without Harm, United for Global Mental Health, WHO, UNITAID, so Arab Republic of Egypt, PAHO, WIPRO, and again, I think this is the most important contribution and at least basically making sure that all of the partners are coming together to address the needs and priorities for countries. The community of practice, you have a QR code. All the case studies that were submitted for this conference are already online, thanks to our colleagues in WHO, Ichi, Lena, Amy, for making sure that this happen. But there are different functionalities, and we are aiming all the time to basically strengthen this community of practice. Progress made. This, under the ATACH community of practice, you can also see a tracker of where we are and where countries are basically in. At the moment, it only includes the commitments as made for COP26, so it's basically vulnerability and adaptation assessments, health national adaptation plan, assessments of emissions at national level, and plans for basically addressing emissions. The data that is included there is also available at regional level. So, and then you can also track where we are in each of the specific countries. Going forward, we want to do better and to also integrate some of key indicators to measure progress with ICANN and to measure progress with the Belém Health Action Plan. So tomorrow there will be a discussion and a specific meeting of the ATACH task team on indicators that Marina Romanello and WHO are leading. And basically we will be thinking about how we can measure progress in the implementation of the Belém Health Action Plan, and colleagues in ICANN are potentially doing the same. This is just a summary of the responses on progress made by the 24 countries that submitted case studies now. And basically what you can see is that most of the progress has happened at the policy level and the assessment. So many countries are saying that they've integrated health within their NDCs, that they conducted health vulnerability and adaptation assessments, that they developed health components of national adaptation plans, and that they are assessing also emissions. Less on implementation, and of course this is the priority for the ATACH. We want to see more on integrated surveillance, on interventions at healthcare facility, in implementation of plans basically also to reduce emissions. Some of the benefits that they say they saw since they joined the ATACH, and I really like this, is basically enhance political commitment and cross-sectoral collaboration, increase knowledge, system-wide impacts, economic benefits in cases where they are implementing, for example, interventions at healthcare facility level, co-benefits, and improve health facilities and services. Their priorities when countries are asked continue to be around the functions that the ATACH mainly has. So it's more on finance, it's capacity building, it's climate-informed surveillance and early warning systems. Again, making clear that the priorities included in the Belém Health Action Plan are relevant for countries, and facilitate peer exchange, lessons learned, and best practices and case studies. With less frequency, they also refer to specific technical topics like low-carbon sustainable health systems, monitoring climate-sensitive diseases, development of assessment and policy documents, and effective climate and health actions. And these are just suggestions. We will go back basically the ATACH Secretariat with the steering group and think how this can be basically taken into consideration to advance the work of the ATACH. Then the review of the desk review that we've done of the health in NAPs, so basically all of the NAPs submitted to the NAP repository, the health components of national adaptation plans that basically are included in the repository that we have in the community of practice, and then on the NDCs, only NDC 3 as of now. So we will continue doing this assessment and published by COP30 this year. This is an assessment of the VNAs, 31 total. Basically, the priority diseases, climate-sensitive diseases that countries include in this vulnerability and adaptation assessment continue to be the infectious diseases, vector-borne, waterborne diseases, malnutrition and foodborne diseases, but we also see that key health impacts are getting more importance in countries. For example, mental health. The previous assessment that we did rarely included mental health as a priority. There are many findings. I think we will share with you all of the reports because it's very interesting to see basically the interventions that are prioritized, the leadership and governance mechanisms that are established at country level, basically information on whether or not the vulnerability and adaptation assessments are led by ministries of health. But again, it's a lot of information. Something that we thought preparing these slides is that this is interesting. Something that we are finding all the time in the NAPs and HNAPs is that even, and I think this is important for equity considerations also, even when countries identify specific priority areas and even climate-sensitive diseases, they don't always integrate into their plans very specific interventions to address their priorities. Maybe this is good because in any case, there are interventions that have to be implemented at system level, but we think that there should be also some specificity on the specific interventions that they should include. And we see that in the HNAP, there is a higher correlation. Basically, there is more specificity, probably because the HNAPs are broader, include more detail, more interventions. But this is an interesting consideration. Something that is important also in terms of understanding the importance of all the priorities included in the Belém Health Action Plan is that when we structure the interventions included in NAPs and HNAPs by country, from countries, the most frequent intervention that they propose is everything related to leadership and governance, again, NDCs, HNAPs, health workforce, more on capacity building, on basically having enough people qualified to understand and address the health impacts from climate change, and also integrated risk monitoring, early warning, and greenhouse gas emissions assessment. Those are the ones coming on the top. And in the HNAPs, it's more or less the same, although we have more about also interventions related to research and evidence. With regards to the assessment, we conducted an assessment of all the NDCs as well submitted as of 17 July, 27 in total. And again, to acknowledge the work done by Amy, but by Stefanaya, by Ichi, everybody in the WHO team. And this is just a little bit ugly slide summarizing the key findings. We see that there is a lower representation of health compared to the assessment that we did in 23. It's just we need to validate the data still, and there are more NDCs hopefully to be submitted. But something that we see is that, for example, health is mentioned in a lower percentage of NDCs under leadership and enabling environment compared to the previous assessment. But for example, there is an increase in terms of identifying health co-benefits of climate mitigation and even quantifying those. So I will not go into details. Again, we can share all the information with you because there is a lot of data on all of these assessments. Now we want to hear from you. My presentation is over. We will not stop just to discuss the results, but if you can please try to respond to these questions, just take a picture to this QR code. It will be open during this session, and then it will help us really to understand priorities for the ATACH going forward. So I think with that, that's everything from my side, and then we'll leave this open for you.
Thank you, Elena, and good morning, everyone. I'm Helen Yaxley. I'm from the UK's Foreign Commonwealth and Development Office, and I'm going to be sort of chairing this session as we move on. And I think it's really great to hear, Elena, how the ATACH has been progressing across the last 2-3 years since it's been set up, and how countries have really been engaging with what they want from ATACH, how they see it developing, how it supports them to implement the commitments that they have made and entered into throughout COPs and also World Health Assemblies and other scenarios, and also how the community of partners that have also come into ATACH, and again, thinking about their role in delivering on the climate and health agenda, how they can support countries, what we do at regional level, what we do at global level. So this is really a collective effort and a platform that is really moving things forward. And I, for one, have been really sort of proud and happy to see how it's really sort of grown over the last few years. And I really want to sort of focus the discussions today on hearing from the countries, from the partners, what they've done and what they're hoping to do, and how they think that ATACH can really support delivery of the new Belém Action Plan as it gets agreed at COP30. So without further ado, I'd like to introduce, well, we're going to have 2 roundtable discussions. The first one will be moderated by Carolyn Teiteshi. She is the Director of Climate Change and Health at the Health Office at Health Canada. She will be joined by 6 ministries of health representatives from the different WHO regions. So I'd like to invite those who haven't come to the stage yet to come and join us up here. So that is His Excellency Ratu Antonio Rabici Lalabalavu, I hope I've pronounced that correctly, Minister of Health of Fiji, and representing the Wipro region. His Excellency Ibrahim Sy, Minister of Health and Social Action of Senegal, representing the Afro region. Hussein Al-Rand, Assistant Under-Secretary of Public Health at the United Arab Emirates from EMRO. Mamunur Rashid, Joint Secretary, Ministry of Health and Family Welfare from Bangladesh, Sierra region. Philip Swan, Climate Change and Health Focal Point and Acting Director of Public Health at the Ministry of Health and Wellness of the Bahamas, representing the PAHO region. And Falco Drews, Senior Scientific Advisor at Environmental Health Protection, Climate and Health at the Federal Ministry of Health of Germany, representing Euro. Carolyn, over to you.
Great, thank you so much, Helena. And thank you to our Brazilian hosts. It's been a great event here yesterday. It was very exciting, lots to talk about, and we're going to get into a little bit more about experiences from all around the world. So we're going to take a little bit of a tour around the world on this panel today and hear from each of the 6 WHO regions. We're going to talk a little bit about climate and health priorities in the regions and your countries, the key needs and challenges that you're seeing and facing, and how can ATACH support to advance these priorities. So let's see how the common challenges that we're facing, the differences that we may be facing, and how we can come together as a global community to really face these challenges together. And encourage the audience too to maybe think about, as we're hearing our speakers, about, are these common challenges that you're facing too? Is this something that is something to be discussed at the breaks, at the lunch, or perhaps that you found a solution to one of the challenges that has been faced here, and that would be great to discuss afterwards as well. So I think we'll go first to Wipro region, and His Excellency Ratu Antonio Rabici Lalabalavu, Minister of Health and Medical Services for Fiji. How are you seeing things? What are the challenges that you're facing, and how can ATACH?
Thank you, and a very good morning to you all, especially to the colleague panelists. And for Fiji, just to reiterate what I've mentioned yesterday, for Fiji and our Pacific neighbors, the impacts of climate change on health are no longer just projections. They are a present-day realities, rising seas, extreme weathers, heat, water, stress already disrupting our health systems as it is and the livelihoods of the people within the WIPRO regions. And these challenges demands that not just resilience but transformations. So in response, WHO regional office through the WHO Asia Pacific Center for Environment and Health and Division of Pacific Technical Support, working to support countries in building climate resilient and sustainable health system through a system-based, country-driven approach. And we are actively advancing several key projects to enhance the resilience of our healthcare systems. And this includes support from the COICA WHO SHAPE projects through strengthening of infrastructure of 5 healthcare facilities and improving wash facilities in 43 locations through UNICEF support, installing solar energy systems in approximately 38 healthcare facilities. Through the COICA WHO SHAPE, Cure Kids, UNICEF, and energy sector, Fiji, and building the capacity of over 1,500 healthcare workers. And in September, the Western Pacific region on climate resilient and sustainable health systems will convene the inaugural Western Pacific Action Forum on climate resilient and sustainable health systems in Singapore. This high-level forum will bring together delegations from 20 countries, including the Pacific, and country members of the Pacific Network for Health and Climate Change to translate strategies into action through focus sessions on healthcare workforce, infrastructure, governance, financing. It will be a key regional step in implementing the ATACH agenda. And Fiji is working closely with WHO to integrate the climate and weather data into our disease and surveillance systems that will help us to anticipate and manage the climate-sensitive diseases. And as a region, we welcome WHO's ACE work, ACE, and finding an investment toolkit, which is supporting countries like Kiribati and Cambodia to better identify access to climate financing for health and initiatives for sustainable food procurement that align climate, nutrition, and public health goals. Importantly, the Pacific is also contributing to global evidence and advocacy. WHO is proud to host the new Lancet Commission on Sea Level Rise, Health and Justice. This commission will elevate the voices of the Pacific nations and generate critical evidence for COP31 and COP33. So how can ATACH help? As a region, we see 3 critical roles for ATACH. One is implementation, that is supporting country-led deliverables of the Belém Health Action Plan through practical region sensitivity tools and technical assistance. Another aspect of the benefit of ATACH is through tracking. It's aligning reporting mechanisms with national systems and regional priorities. This will allow us to help monitor progress in ways that are meaningful and actionable. And thirdly is the regionalization and mobilization. Above all, we call on ATACH to adopt a regionalized approach that reflects the specific needs of Asia and the Pacific. And this means dedicating focused attention to the Pacific's unique vulnerabilities, ensuring our voices are represented and supporting access to climate and health financing that reaches our frontline communities. With the right support, our region can lead the world in showing how climate delivers for health, I believe, and how health can drive climate ambition. As we in WIPRO, especially in the Pacific region, it is one of the most vulnerable regions that is affected by climate change, and we live it on a day-to-day basis. And it's something that through WIPRO and ATACH, we believe we can implement the deliverables, especially those that are within the National Adaptation Plan for respective countries. NAC.
Excellent. Thank you for your reflections and the reminder too that this is about a reality now. It's not about the future. This is what we are facing and how urgent it is for us to take action and to be working together. So thank you very much. We're now going to go to the Afro region and His Excellency Sai from Senegal. How are you seeing things from your perspective, and what do you see as the priorities and how ATACH can help? One, maybe.
Merci beaucoup. Je me réjouis.
I'm very happy to participate of this so important moment. Thank you so much for these important issues and questions, and has a high importance for Afro region regarding WHO. So let's define the level of priorities on this region, but equally what we expect from the initiative that we and what we could reach with it. So we need to get the national contribution and the negotiation regarding climate. And secondly, we need to reinforce governance, the climate issue. And third, we need to invest on the health politics documents. Nowadays, the country needs to integrate on these issues on the national terms of contribution. So we need to observe these vulnerability issues of these questions, because we got countries that are behind and not even start the assessment about vulnerabilities. So there's no way to have this plan without those assessments. And then we need to have an assessment which is very important to reinforce those regions, and we need to promote infrastructure regarding green gases emissions and overall inequalities of access related to these issues. And then we need to develop systems that do not help these climate issues, and we need to implement. And we have a lot of challenges to face, and we have to have an alignment with the health policy and climate policy. So we need to integrate both, so they would take into consideration on the country strategies. And we need to elaborate a health and climate agenda on a national level and on the regional level at Afro regions, with civil indicators clear, so we could measure that and justify of that. And the third challenge is the governance issue related with research regarding these global issues, but we don't have scientific data that allowed us to show all of that about climate. So it's really important. So we need to talk about it, about budget related to it. So we have an excess of mortality that comes from climate and the budget that we got. So we need to increase this part of health on the budget. So we have to have an additional for climate issues. Other challenge is the mobilization of the public health system for climate adaptation. So the time management
and deadline management. So we have these processes related to climate. So we have to pay attention to the time to submit this project. So all these issues, due to the need to act, we need to speak of health, of diseases. If we cannot diagnose and treat, this means the patient is lost. This is a metaphor used to show people the urgency of acting when it comes to climate change and health. So when someone is sick, you don't have to wait years to solve that. You have to do that quickly. It's very important for us. In this challenge, there's the operation of the National Adaptation Plan of indicators and other challenges, the sanitary issues with climate. So talking about the weight for the ATACH initiative, reinforcing security technologies and also reinforcing the governance capability, and have financial resources and be able to count on them also, and also the support of support in issues of gas emissions, also the issue of vulnerability, the National Plan of National Security. Today, like all the other sectors, we need to have a plan to mitigate gas emissions and initiatives that have started and show very significant results. Last but not least, how to put in practice these plans in the ATACH initiative in matters of the Ministry of Health. Thank you very much. Thank you very much.
And it sounds like a lot of great ideas too in terms of how ATACH can help advance tackling some of these challenges. So now we'll move to the Emirates region with Dr. Hussein Al-Rand, Assistant Undersecretary of Public Health, United Arab Emirates. Okay, I'm good.
Good morning, greeting from United Arab Emirates, and happy to be you and to join this panel discussion. We welcome this opportunity to reflect on climate health priorities in United Arab Emirates and Emirates region, and how platforms like ATACH can help accelerate solutions. The United Arab Emirates and Eastern Mediterranean region is experiencing climate impact at an accelerated pace. These include rising temperature and humidity together and more extreme hot seasons, erratic rainfalls, alteration in the seawater, salinity and sea level, rise affecting marine and ecosystem and coastal cities. Eastern Mediterranean region faces a unique set of challenges that amplify health impact of climate change. Ongoing emergencies, conflict, and political instability contribute to the rising numbers of migrants and refugees, growing health inequity, strained resources, limited data and evidence, fragile health and related infrastructure, and fragmented policy and government system. We are seeing more heat-related illness, respiratory and cardiovascular conditions, vector and water and foodborne diseases, and increasingly the mental health burden from environmental stress and displacement. These tend demand urgent action and system-level transformation. To address this, our region adopted and endorsed the WHO EMRU framework for climate and health 2023 and 2029. In the United Arab Emirates, we are finalizing our national health adaptation plan to be launched before and end of this year. Other countries like Jordan has recently launched their updated HNAB, and many others also adapted in the region are also in the making process. Let me highlight our region's 7 core priorities. Training and awareness for our entire health workforce, from doctor to nurses and health worker, developmental of a national green health facility index to guide sustainable and climate resilient upgrades in our healthcare facilities and sector, launching heat health plan for example, in United Arab Emirates, we launched earlier this month heat exhaustion and diseases prevention campaign focusing on worker safety in extremely heat, implementing an early warning system for heat, dust, pollution, and vector-borne threats, communicating timely health messages to the community, reducing death attribution from air pollution, especially from short-lived climate pollutions, ensuring 100% access to safe water and sanitation during climate emergencies, scaling up climate and health research to guide policy and innovation. These efforts reflect our regional commitment to resilient, but they are not without challenges. First, we face technical capacity. These are the challenges which we are facing, and thank you very much.
Excellent. Thank you very much for outlining those key priorities and the challenges, which again, I think we're starting to see some themes around data, the financing, and thank you for also raising the issue of the public awareness and the need for behavioral change, and how do we engage our populations in really understanding the new risks that they weren't normally prepared for. So thank you for that. We'll now turn to Southeast Asia region with Dr. Rashid from Bangladesh.
Thank you very much. I am very much pleased to share key climate and health priorities for the WHO Southeast Asia region, along with some critical needs and opportunities for ATACH engagement. So let me start with a very simple question. Can we protect our health in a situation where thermometers are keeping rise, flood and disasters are growing concern and deferred, and air is becoming gradually toxic to breathe? So answer is simply no. So what to do next? To continue dialogue as we are now doing, to sustain conversation, to cooperate, to collaborate. And ATACH is doing the very good thing in the leadership of WHO. So that's a very mind-blowing initiative in terms of climate and health in Southeast Asia region. So since Southeast Asia region, countries are facing the same, almost more or less same situation. For example, the climate health threats are growing concern. The climate-induced disease like waterborne, vector, tuberculosis, and all those are very prone to the region, especially the slum dwellers. And the vulnerable population are in a critical situation. You know, the Southeast Asia region have 2 billion population. And the priority agenda of the Southeast Asia in terms of ATACH, it's not an agenda. Rather, it's a tool of survival of human lives. It's a strategy of survival of human lives. And despite all the challenges, countries have made significant progress. As per climate change and health survey conducted by WHO and Southeast Asia region by 2024, 8 countries have developed Health National Adaptation Plan. And most of them have multi-sectoral collaboration mechanism in place, linking with health, with water, environment, disaster, power, solar, and everything. And 5 countries are now collaborating with meteorological agencies, early warning and response system in terms of extreme heat waves and all the disaster climate prone. And 4 countries have begun retrofitting health facilities for resilience. 9 report action on waste energy infrastructure. For example, Thailand is scaling solar energy over 1,500 facilities. And almost more than 50% of health workers, health workforce, have informed climate smart healthcare system. So financing remains a critical barrier and include the lack of information, limited technical capacity, and weak linkage between health and all other sectors that is directly and indirectly related with the health response. And our regional priority is very specific to strengthen climate resilient and sustainable low carbon healthcare system. How to improve surveillance and early warning and response system. Sorry. And how to capacity building of the health workforce so that they could have some climate informed understanding, each and every health workforce along with some of the communities. And securing sustainable financing and scaling up mitigation along with emissions reductions. And ATACH is now doing a very transformative role in terms of building technical and institutional capacity to implement Health National Adaptation Plan in each and every country. And supporting access to climate finance, just like Green Climate Fund, Adaptation Fund. And to facilitate and exchange, sharing, showcasing innovations and best practices of the region, so that each and every country to be sustained, to be continued the best practice, the best way of health addressing, and to helping mainstreaming health into climate policy, including NDCs and national adaptation strategies. And additionally, ATACH can support health system decarbonizing planning and greenhouse gas baseline survey assessment, and multi-sectoral collaboration between health and all other sectors, and to develop a shared monitoring and evaluation. But very important to do some research in terms of the region and to be specified that should be country specific so that the research funding could be translated into actions in the practical ground level. That's very important. And Southeast Asia is no stranger to climate disaster. At the same time, it is no stranger to strength, to solidarity, to cooperate, to have a better understanding of climate science and all other that are directly related to the healthcare system. And let us stand together through ATACH, where every health facility becomes stronger, where every health workers become climate smart, where every community becomes climate informed, where health agenda is not just a checklist, rather it's a survival strategy. You imagine a situation, a baby girl born in 2035 who is not battered by health and floods and climate disaster, Rather, she is born in a solar power clinic. She is attended by a climate-trained midwife, and she is bringing up in a community that is early warned and response system activating. And she is growing of her own way as of human rights and climate justice. So that is the world we are working together in collaboration with ATACH and World Health Organization in the Southeast Asia region. Let us stand together to prevent, to prepare, and to protect our health in future. Thank you very much.
Excellent. Thank you so much for giving us that vision of the future. We need that hopeful, and thank you for talking about the progress that's been made in the region, and highlighting the fact that we need that multi-sectoral action. So it's not just collaborating amongst ourselves within the health sector across the world, but also how do we work with those other sectors, the meteorological services and others to make that change. Excellent. We'll now be moving to the PAHO region and Dr. Swan from the Bahamas.
Thank you and good morning. I'd like to mention that I'm speaking on behalf of the PAHO region. We would have been assisted with our PAHO office and coordinating and putting together all of the responses we received. And my first sharing with you this morning is what are the region's climate and health priorities and key challenges to advance them. So the region of the Americas is among the more vulnerable regions of the world when it comes to climate change. This is only exacerbated by the region's storied history of inequities between its member countries and within member countries as well. There is no existing mechanism that has been accepted and applied that will reduce these inequities. Thus, a central focus and starting point must be to provide countries with information that is crucial to providing a perspective from which mitigation and preparedness to respond to the impact of climate change on health can occur. In the interim, countries in the region can work toward identifying and implementing steps, policies, and initiatives that are geared towards the establishment and strengthening of health systems that are sustainably climate resilient. A sustainably climate resilient health system is one in which there is increasing awareness as well as intentional efforts at strengthening institutional and technical capacities at all levels of the health sector to address factors that relate to climate change and health. Additionally, this requires the exploring, development, and characterizing of the features that describe the adaptive capacity of a health system to manage climate-sensitive diseases such as vector-borne illnesses, respiratory illnesses, and health challenges caused by heat waves. Critical mitigative components toward building resilience are integrated climate and health surveillance systems and early warning systems, from which evidence is generated to targeted actions. Further, there is a need to review which physical components of resilience can be incorporated in the building and retrofitting of health infrastructure to make them climate smart and able to withstand extreme weather events and disasters. A climate-resilient health system goes beyond physical infrastructure and technology, but incorporates the human element through the promotion of social participation through an equity-based lens, therefore ensuring that measures are identified that also benefit vulnerable populations. Further, the approach of promoting the importance of meaningful collaboration across agriculture, energy, environment, health, and transportation sectors is necessary for countries to act toward fulfilling commitments outlined in the national climate change strategic documents, such as the nationally determined contributions and national adaptation plans, and which can further support the advancement of successful arguments for securing funding and financing to implement climate and health actions. Though as a region, we have identified these necessary steps, we are not blind to the real challenges that hinder the types of progress we would like to see in this area. These include insufficient information and assessment of the existing health system realities, coupled with the inadequate technical and operational capacity of health services and skills to adapt our processes to climate change. In most countries, due to the ongoing battle for funding of sector-specific programs, there is weak commitment to intersectoral coordination, which results in scarcity of financial and human resources for sustained implementation. Additionally, regionally, there is limited data, evidence, and research on emerging systems, emerging diseases, and health outcomes associated with climate change and the impact on populations, and a shortage of trained health personnel in climate change and health. Thank you.
Excellent. Thank you so much, Dr. Swan, for highlighting those key things and highlighting the need for social participation and the equity-related issues. We'll now go to Euro region with Dr. Falco from Germany.
Good morning, everyone. First of all, I would like to thank the team of Brazil to host this important conference here today on the pathway to Belém. And second, thanks, Caroline, for giving me the opportunity to present the situation and course of action in the WHO European region. This region, which comprises 53 countries, we are already suffer with the impacts of climate change with increasing intensity, because Europe is the fastest warming region in the world. And second, Europe is inhabited by a vulnerable, aged population, which is served by an excellent, but also resource-intensive healthcare system. Therefore, our health systems must be at the forefront of both adaptation and mitigation efforts to protect public health on one side and to contribute to the climate solutions on the other side. Believe me, this is an enormous responsibility. Aware of this, in 2023, the member states adopted the so-called Budapest Declaration, which sets out our shared commitment to address the global triple crisis. The declaration outlines the following regional priorities. First, adaptation and resilience, which means develop, update, and implement health national adaptation plans, and to develop and update heat health action plans. And finally, strengthen natural disaster risk reduction policies and climate-informed health early warning and surveillance systems. The second priorities are mitigation and sustainability, which means establish health center targets in national planning, especially with NDCs under the Paris Agreement, and also make healthcare systems climate resilient, environmentally sustainable, and above all, climate neutral. For example, by using green energy in buildings and transportation, less resource consumption and greening supply chains, and to improve health mitigation measures, active mobility, sustainable diets, and improved waste management. And last but not least, strengthen the climate literacy of health professionals, empowering to engage the climate policy and respond to health impacts. To tackle all these priorities, the WHO European Partnership for Health Sector Climate Action, led by Ireland, serves as our regional community of practice, fostering collaboration, peer learning, and capacity building across member states. The partnership is aligned with the key global frameworks, from the ATACH to the Global Action Plan. Germany is one of 11 partners of this network. Although our European healthcare systems are heterogeneous, we greatly benefit from this fruitful exchange. On behalf of the partnership, I invite other European countries to participate and to benefit from our network. And now, how can ATACH support us? The European Partnership for Health Sector Climate Action is our essential regional-driven initiative that supports the implementation of the European agreed climate and health priorities. This partnership supports countries in building climate-resilient, low-carbon health systems by strategic discussions, peer-to-peer arrangement, and deep dive webinars, for example, on climate-friendly transport in the health sector a few months ago. Of course, we are dealing with several issues that are also being addressed in the task teams of ATACH, but with a distinct European view. While the focus of the European partnership is tailored to the specific needs and vulnerabilities in the European regions, the partnership is also strategically aligned with global efforts of broader framework, such as the 2024 World Health Assembly Resolution on Climate and Health, and the Global Action Plan on Climate Change and Health. With respect to the Belém Action Plan, we therefore suggest to include a section on how it relates to and complements the WHA resolution and its operationalization through the Global Plan of Action, as well as other relevant multilateral frameworks. And also take into consideration the different health systems, for example, the level of centralization. No doubt, the European partnership clearly complements the effort of ATACH, but is not a regional chapter of ATACH. And needless to say, the work of ATACH is especially relevant for convening the global power of the health sector and promoting coherence on health and climate action. And to be more practical, ATACH can distribute the products from the task teams to the regions. Therefore, the ATACH can continue playing a supporting role for our region by first, promoting the partnership events on outputs to a wider audience. Second, by sharing updates from the region and the work of the partnership in global coordination meetings. And third, by helping to connect European experiences with other regions, fostering cross-regional learning in both directions. Because some problems and approaches are identical and transferable, others are scalable. Through this synergy with the ATACH, our partnership strengthens the region's voice in global climate and health discussions, while ensuring that global momentum reinforces national and regional implementation. Finally, the work of the ATACH and also of the WHO Office Euro must be highlighted as an essential success factor for our engagement in climate change and health in Europe, reaching out from the strategic and scientific framework to cost-cutting issues in terms of organizational support and progresses. Thank you very much.
Excellent. Thank you so much, everyone. Do we have time for one question? We do. 5 minutes, 5 minutes. I think because everyone was so great at staying on time, I think we might have time. Just pose one question. Now that all of you have heard the perspectives from each of the regions, I want to throw it back out to anybody who wants to take a try at reflecting on this. I've noted a lot of common themes, including financing, the urgency of actions, the need for public participation and equity issues, the need to bring to also tackle GHG emissions in the health sector and be a part of that climate solution, governance and policy, need for multi-sectoral action, data monitoring and surveillance, healthcare workforce as a part of the solution and the capacity building needed, mainstreaming, collaboration, a lot of really great common themes all across the regions. I wonder if people could reflect a little bit too, there's also differences amongst the regions and differences amongst countries. How do you see then where the areas that are best placed for global action to bring us all together, and where do you see regional action being the most appropriate in these areas? Does anyone want to take a step?
Thank you very much. I think cooperation is important. And as we have ATACH, we can all work together through ATACH to cooperate together and see how we find solution. Like, for example, the data fragmentation. This is an important subject, how to get the data. because in each country, the data is different, and you cannot access the data. If you don't access the data, you cannot find solution. Thank you.
I think climate financing is very much important because, for example, we have a healthcare financing strategy 2012 to 2032. But there are some of the features, just like, for example, the public-private partnership. How we should go for public-private partnership in the healthcare system to build climate resilient and sustainable low-carbon healthcare system. Public-private partnership is very important. Only governmental investment is not possible. Only the local investment is not possible to do that. So how could we access the public-private financing as a form of climate health financing investment? That is a very good issue to way forward to, for example, the Health National Adaptation Plan we have. But how to implement? This requires some cooperation, technical resources, and capacity building, and altogether, definitely financial resource is a must. And financial resource is not possible only for a country. Better, it should come forward other than the governmental side, private-public partnership. That is important. So how to accelerate, encourage the public-private partnership in the healthcare system? That is very important in terms of my understanding. That is very good issue. And if you allow, I want to another issue that prevention is very much important. Prevention. So how to prevent all those? How mass medical college and nurse doctors you will produce? Rather, to prevent is a sustainable solution. We want to build a sustainable healthcare system that will be low carbon, low emission. But that requires to capacity building of the health workforce as well as a better understanding of the community. Each and every community should have a better understanding how to engage all the non-state actors, non-state organization. That's much more important to do, to translate all the words into actions in the practical field. So thank you very much.
Thank you. One of the things that we all mentioned was that of training. And there, of course, is always the focus talking about the health sector, training of nurses, physicians, and other clinicians. But also, I think we need to keep in mind as well, the training of administrators, those persons that actually maintain the health system, those who make the decisions about how energy is burnt or spent and how you can conserve energy. So having workshops to work with those individuals as to what are some of the things you can do in your health facility that can reduce its carbon footprint as well as can reduce its emissions, greenhouse emission gases. I think those are some of the things we need to focus on as well. Thank you.
Thank you. I would say in the experience of Fiji in the Pacific, it's more support and emphasis on regionalism, regional support. The reason why I say this is that within the Pacific, our small island nations, on its own, you can't do much with the economy and the burden of diseases that occur within each respective country. But together, we come together and share ideas on how we can help each other, assist each other, and also ask for help in terms of the regional approach. And to say that, we've started this with our own, we have our own Pacific Health Ministers meeting. It happens every biannual. And with that, we've noticed, and that has changed just recently, issues discussed at the health ministers level are not usually taken right up to the Pacific Leaders Meeting in terms of the issues of climate and health. The Pacific Leaders Meeting mostly focuses on just climate change itself. And I would say, in order for us to want to bring the issue of climate and health in COP30, it must start first at the regional level. You need to strengthen that first there before we can bring issues up and discuss it where all are at the table. Thank you.
Merci beaucoup. Juste par rapport à ce que nous avons dit.
And the health system, to take in consideration the complexity that changes very fast. So those impacts accumulated itself, so can be able to adapt and predict those impacts. And I believe that today the most important is to enforce capacity building of all the players there are on this health system, and we could be able to integrate and have a better work on this point.
Thank you so much for everybody for sharing your experiences. Merci beaucoup à tout le monde ici. I think we've heard a lot of commonalities, a lot of energy, a lot of action taking place in the regions, and a lot more work that we can do together. So thank you. Hope you join me in thanking our panelists here.
Hello? Oh, yeah. Okay. Do you want a photo? Yeah, so if you could all join together and have a quick photo, and then I'd like to invite you to leave the stage and we'll bring the next panelists up. Okay. And I have just been advised we're running a little bit late, so we're going to try and manage the next session quickly. So, without further ado, I'd like to introduce Jerome Weinbach, Deputy Director for European and International Affairs from the Ministry of Labour, Health and Solidarities and Family of France. He will be moderating this next panel. And I'd like to invite the panelists to join us here on stage. So this is Sion-Mi Choi, Senior Climate Environment Advisor from the Global Fund. Sion-Mi, if you can come and join us. Kimberly Humphrey, Board Member of the Doctors for the Environment Australia.
Oui.
Fawzia Rashid, Senior Advisor in Climate and Environment Lead for the Aga Khan Development Network. Talita Gobi, Head of Sustainability in Brazil for AstraZeneca. And Tatiana Porto, Director of Public Affairs from Sanofi. Talita and Tatiana are also representative of the Sustainable Markets Initiative. Nancy Aburto, Deputy Director of Food and Nutrition Division of the Food and Agriculture Organization. And Cecilia Sorensen, Director of Global Consortium of Climate and Health Education at Columbia University. So I'd like to hand over to Jerome. These are they're representatives of the constituency groups of partners. So we've heard from countries. We're now going to hear from a range of partners and the constituencies that they represent in the role of ATACH, what they've been doing to further progress the objectives of ATACH, and also a future-looking agenda. Thank you.
Thank you so much, Hélène. So, first of all, on behalf of France, I would like to deeply thank our Brazilian colleagues and friends for the organization of this conference, also for hosting the ATACH event today, and for the organization of the COP30. So I wish you a lot of success, and we wish us a lot of success for the COP30 and the special Climate and Health Day. But let's come back to a key initiative that brings us all together today. This is ATACH. So the Alliance launched at the COP26 and hosted by WHO give its members a clear mandate and guidance to achieve ambitious targets for carbon neutrality in line with the goals of the Paris Agreement, for which we are celebrating the 10th anniversary this year. And I'm glad also to have Paris municipality and city representative today. I do believe that cities have also a key role to play in climate change and hence adaptation. So that's very important also for us to have cities representative here today. To reach carbon neutrality and to have resilient health systems, we need a roadmap, a plan for action, and a collective and intersectoral effort. That is where the Belém Action Plan on climate and health comes into play. We strongly support its focus on equity, climate justice, and social participation, which aligns with France's priorities. France, just like many other countries here today, is pursuing its efforts, working in conjunction with the ATACH to achieve carbon neutrality for its healthcare sector by 2050. We have launched an interministerial ecological planning roadmap for the healthcare system, which aims to reduce its greenhouse gas emission by 5% per year until 2050. And we are promoting also the One Health approach, very important to achieve our goals and objectives. And we are ready to share the French experience also with other countries and regions. But now come back to a very rich and diverse panel, very interesting because we have representatives ranging from the private sector to NGOs, to academics, and to international UN organizations, well, with FAO today, the Food and Agriculture Organization, and also a major fund, the Global Fund, fighting against TB, malaria, and HIV, which has also integrated the climate change issues in its activities and approaches, so very important. I will ask in a row 2 questions to each panelist, and they will answer in one shot. So the 2 questions are the following. The first one is, how can your organization best leverage on your expertise and influence, first of all, and what contribution can your organization and overall constituency make to advance the climate and health agenda at country level? And the other way around, how ATACH support these climate and health efforts you are developing and implementing and your priorities? So I will start with the first speaker, who is Seonmi Choi, working at the Global Fund as Senior Climate Advisor. You have also worked for 15 years, at least at the United Nations, managing the UN Action Program on Climate and Environment in Asia Pacific and in Africa. So, Seonmi, the floor is yours.
Great, thank you so much. My name is Sunmi. I'm the technical lead on climate change and environmental issues at the Global Fund Secretariat based in Geneva. Very pleased to join this discussion. First question, I would like to first emphasize that the Global Fund to fight HIV, TB, malaria, we are addressing this climate change impacts on health issue really through our core mission lens. So basically, our main approach when it comes to addressing observed impacts of climate change and future projected impacts of climate on health are really about integrating climate-related disaster risk management as well as environmental sustainability into our core programs, namely HIV, TB, malaria control efforts, as well as also our core investments in health systems strengthening. I think, first of all, it's really important for us to understand and be aware of the widespread and negative impacts of climate-related extreme weather events across so many low and middle-income developing countries. So Global Fund has been providing rapid and flexible emergency funding support to many countries in the aftermath of extreme weather events, notably, for instance, devastating floods in Pakistan, as you all must have heard of, as well as one of the worst flooding events in Bangladesh last year, also in severe droughts in Somalia and Zambia. We're actually seeing a huge number of increasing climate-driven public health emergencies, and Global Fund has been providing rapid and flexible public health emergency response actions in many of the countries. And when we are looking at also on overall our investment the Global Fund makes, over 70% of our Global Fund core grants are actually in 50 most climate vulnerable countries. So for us, it's not an option, but to really adapt to the changing climate and really help countries address already observed immediate consequences of climate-related extreme weather events on health systems. And we're very pleased to also share with you an update that we have earlier this year. We have launched our first ever Climate and Health Catalytic Fund, and huge thanks to our partners here present also, and Gates Foundation and Fondation S for their kind and generous support for us to be able to launch this first ever Catalytic Fund on climate and health. And this Catalytic Fund is really based on and leveraging our existing strength and comparative advantage of the Global Fund. First of all, we're looking at prioritizing countries and country investment areas based on country needs. So we're really looking at how to actually leverage Global Fund's proven funding model, which is really needs-based financing. So basically, for instance, for the Catalytic Fund investment prioritization, where we're looking at global disease burden of the countries, as well as, of course, countries' economic capacity, and also the climate vulnerability and readiness of the countries to adapt to a changing climate. I am instructed to conclude very soon. And I think it will be really, we're very pleased to also inform you that our catalytic investments on climate and health are very much aligned with all the action priorities of the Belém Health Action Plan, ranging from climate and health vulnerability risk assessment to cross-sectoral coordination capacity building, also to climate-informed disease surveillance and early warning systems, but also specific essential life-saving medical products and innovation to ensure uninterrupted service delivery for key vulnerable populations, especially in areas most exposed to multiple climate hazards. Let me see.
Thank you very much, Seonmi. Very interesting to hear about your adaptation also in your activities. And the word catalytic funding is quite important as well, how funds dedicated to climate change and health could attract additional funds as well. So very interesting. Now I move to Kimberly Humphrey. So Kimberly, you're a specialist in emergency medicine, but you are also board member of the Australian Doctors for the Environment NGO. I don't know whether I should speak about an NGO, but you will explain a little bit your point of view and contributions as well.
Thank you so much. Good morning, everybody, and thank you to the team from Brazil and all partners that have enabled us to be here today. I am representing Doctors for the Environment Australia, who represents all health professional associations on the steering group for ATACH. Health professionals across the world comprises millions and millions of workers, not just doctors, but nurses, allied health professionals, community health workers, such a wide spectrum of people who are at the front lines, who are seeing the impacts of climate change in their practice every single day. For health professionals, none of this is theoretical. We see when things work, we see when things don't work, we see when adaptation fails, when there's not the money to do what we need to do as well. From our discussions across our constituency, there have been some really key points that have come up. Number one is that health professionals are often seen as advocates, but health professionals see themselves as implementers. They are at the front lines and they are doing the work, not only speaking about the impacts of climate change on health, but they are in there, they are decarbonising workplaces, they're supporting sustainable procurement, they're embedding climate and health in education, leading workforce climate resilient initiatives, elevating the mental health of both the patients and the workforce, and using indicators to track climate resilient and low carbon health systems. They turn ideas into action because they combine broad membership, clinical insight, and community trust. Some other things have really come out to us when we've talked across our constituency. We must acknowledge who is underrepresented. If you look at the health professional associations that are on ATACH, they are very, very comprehensively from wealthy countries. We have very scant membership from less resource countries who, of course, often are the ones that are really suffering the impacts of climate change. We need more health professional associations from countries and communities that are from under-resourced settings and that are most affected by climate change. And this includes Indigenous and First Nations communities. These voices must be elevated. When we've talked to these organisations about why they've not been involved, it comes down to things that affect all of us who are working in health: lack of resourcing, lack of funding, competing priorities. But also some have not been aware that ATACH is something that they could be involved with as well. One of the things we're working very hardly across our constituency for is to involve more of these voices and to elevate these voices who are so important in ensuring we get to where we need to get as a voice of health professionals. We also know that workforce adaptation and safety is a very big focus for health professionals and something that they would like to see further amplified within ATACH as well. So how can ATACH help HPAs and Doctors for the Environment do what we need to do? So ensuring that we help to elevate those voices who are from less resource settings. How can we bring them into this? How can we have assistance to get more people in the conversation who need to be there? Recognising the value of health professionals, not just as advocates, but also as implementers as well. And the real power that they bring, bringing together those different perspectives of the doers, but also understanding the policy and the higher level as well. How can we ensure that things like funding get down to the ground level and can be used where they really need to be used as well? I'll conclude there. Thank you so much.
Thank you so much, Kimberly. Also very important to come back to human beings and putting health professionals at the center of the action plans. This is extremely important. Same for citizens, but they are also citizens. So a very important point here, human resources, human forces for implementing the action plan, starting with the health professional. Then let's move to Fauzia Rashid. You are Senior Advisor on Climate and Environment, lead for the AGA Development Network. You are immunologist, expert in public health governance, and you are leading decarbonation initiatives for health operation in 8 countries. You have worked with over 20 governments and organizations such as WHO, UNAIDS, and the Global Fund. So please, the floor is yours, Fauzia.
Thank you so much, and surprised to have my bio read out. I'm here both for the Aga Khan Health Services, but also as a representative of the NGO constituency on the steering group of the ATACH. And with the Aga Khan Health Services, we have led decarbonization efforts. We've provided training tools to the ATACH for free, and we have trained representatives of nearly 70 governments, not just in evaluating their carbon footprint, but in seeing how much of the journey to decarbonization saves money, and we continue to do that with the ATACH. So now to the comments from our constituencies, and just to say we set up a sort of consultation loop to do this and managed to reach, in the process, about 43,000 members from all regions of the world. Time was short, so we don't have much in the way of comments, but I will do my best to summarize what's come in. And just to put this in context, clearly the NGO sector has a long tradition of holding governments to account. And to date, on climate, the NGO sector has backed several protocols, accords, plans, treaties. And so, of course, you can assume support for the Belém Action Plan, which has many virtues. That said, participation and signatories will be judged on the basis of what they do and not what they say. And you will count on the NGO sector to continue calls also for what they believe is important alongside the Belém Health Action Plan, such as the petition to phase out fossil fuels, which was signed by agencies representing millions of health workers in the lead up to previous COPs, and that work must continue. And for the NGO sector to make a difference, this is part of the feedback, they need to be part of the dialogue. And remote participation in events like this was repeatedly called for, and there is dismay that it's still necessary to physically come to events like this. To make an impact, the NGO sector needs to be coordinated, just like governments will need to be coordinated, they will need direction, and they will need finance. So, I'm going to start with some of the additional areas which were suggested for the plan and then go to some comments on the plan itself as is. Additional comments included specific dedicated funds for countries and communities most at risk, that's been said by many others, and that the plan should cover planetary health to better reflect the systemic connections between the environment and health. And in terms of innovation and technology, the public investment in health innovations must be governed by a Creative Commons or open source rather than proprietary patents. So this was called for. And actions to regulate the pharmaceutical and medtech industries, much as has been done for the transport sector, to set disclosures for carbon emissions and goals to decarbonization should be acted by governments. Similarly, governments should use their agency to set in place smart procurement policies and use their tax and incentives against items such as plastic use and in favor of green technologies and efficient energy use. In terms of the support for the plan, there was much that was said in terms of supporting implementation and tracking progress, which NGOs largely do. If you were to map what's already happening, you'll find much alignment. They also design public information campaigns more than most, and so they will consider themselves to be principal actors in raising awareness, in building capacity, also in informing early warning systems, which a suggestion was that out-migration of health workers should be included within early warning systems, and that monitoring should include transparency in financing and tracking investments in the public sector. In terms of promoting health as a core pillar of the Climate Action Plan ahead of COP30, many areas were suggested, but including integration within the NDCs. Multi-sectoral engagement was considered to be particularly important for this sector, and to engage non-health sector actors such as those working in the environment, urban planning and agriculture, as well as highlighting the health co-benefits of climate actions such as reducing air pollution, improving water and sanitation infrastructure. And inclusion of those who are marginalized, particularly youth and indigenous communities, was referred to in many contexts. So I will conclude there, just to say that there is much more that came in through the consultation. We'll do our best to write it up and share back. Anyone who hasn't been part of it and wants to check me out on LinkedIn, we have all of the addresses there, so this process will continue. Thank you so much.
Thank you very much, Fauzia, for pointing out the very important role of NGOs, not only because they know the ground, they are at the core of the action most of the time, but also for their relationship with governments, making sure beyond talks, declaration, there is a political continuum in implementing concrete action on the ground. Very important. We need you also, and I say that because I'm Minister of Health, civil servant, but we need you also for that reason, the political continuum and concrete actions of the governments. Let's move to now, I would say the private sector and representative of the pharma companies. Very important also players. We talked this morning about public-private partnerships, but your point of view also coming from an initiative called I think the market, well, Sustainable Markets Initiative, and we have two representatives of two big pharma groups here. We will start with Thalita Gobi. So Thalita, you are head of the Sustainability and Equity in Brazil at AstraZeneca for 7 years now, and you will talk also on behalf of this Sustainable Markets Initiative and the Health System Task Force. You have also worked for the UN World Food Programme, I think. So your knowledge of the international organization is also key for this.
Thanks so much. I think it's working, right? So thank you. It's a privilege to actually join you here today here in Brasília and representing AstraZeneca and the SMI. So SMI stands for Sustainable Market Initiative, and it was basically created at COP26 in Glasgow, with the main goal to decarbonize healthcare systems. So this is a platform where we bring together the private sector, WHO, academia, and key stakeholders. And the reason why SMI was created is because the healthcare sector accounts for around 5% of the global greenhouse gas emissions. So it's quite a lot. And of course, we have, as a private sector, a duty in this case. And the two major sectors that contribute to these emissions is supply chain and the patient care pathway. So they both together represent around like 95% of our emissions. So that's why SMI launched two task forces, and that's why I'm here today. We'll be talking about the supply chain. My colleague Tatiana will be talking about the patient care pathway. And on supply chain, of course, we as companies alone cannot do this by ourselves. So we have to engage with our suppliers. So we have launched shared targets to reduce our carbon emissions. So this is the first thing. The second thing is about education. So we understand that it is important to invest in education and upskilling those suppliers. Up to date, we have educated around like 200 suppliers across the globe. And also the other piece that you have been engaging quite a lot is in the sense, is still in the piece of education, is with the healthcare professionals. So we understand that empowering them and connecting climate with health is important to consider this in the medical education. So we have started in Europe, so we have been engaging with around 40 European universities, but of course our aim is to expand these to other regions, like here in Latin America, even to Asia and so on. So education is, I think, is a key piece. And if I can use my last minute, I would say that ATACH today and this conference is a great way actually to bring all the sectors together to share best practice, share knowledge. And ATACH could serve as a hub to actually not only bringing together those key stakeholders, but to avoid silos, because we see great initiatives here and there, but how we can have like a common and single agenda so we can have like a better impact and consider like great outcomes. So I think there's a long way to go, but of course we're glad about the progress that we have made so far, and happy to contribute to this agenda. Thank you.
So let's move to another pharma group, Sanofi, namely with Tatiana Porto. You are Director of Global Public Affairs at Sanofi, and you are also speaking here on behalf of SMI, the Sustainable Market Initiative.
Thank you very much. Very good morning. The patient care pathway represents almost 50% of the carbon emission of the health system. So it's important to access the impact of the different components of it to measure it in a very clear way. So that's why we created a public-private task force to proceed this task in 3 different fronts. So the first of them is considering the products. So we are working to implement and to develop a standard, international standard to measure the impact, and it is being done through public-private partnership. And the standardization is going to be done by the British Standard Institute, and this is going to be available by October this year. The second front is regarding the patient journey. So it also aims to measure the patient footprint, environmental footprint, and how the improvement on patient outcome can also improve the emissions. So this is also being held by a public-private partnership. And the last one is regarding the clinical trials. We are going to develop like a tool to measure the footprint generated by clinical trials. So it's really important to work together with the different stakeholders engaged in the health system. And that's why we are, we created a panel to engage with the U.S. National Academy of Medicines, the NHS, WHO, ATACH, and also patient associations and insurers, payers, and so on, to guarantee that we are really aligned and that the deliverables that we are going to have this year is adherent to the proposal of ATACH. So it's really important to understand ATACH's members' needs and requirements, but also to share what is being doing and what is going to be delivered. Mm-hmm. And also to think about to build the next steps together. So that's it. Thank you very much.
So maybe one comment, because maybe you don't know that last year in Sweden, a vaccine production plant had to stop its activities due to a heat wave because the air condition was not adapted to the situation. I would say for the industry, it's of course about decarbonation, but also about adaptation of the full value chain of medical products. Another comment is the One Health approach and the partnership you mentioned. What we rarely mention is a private-to-private partnership between the pharma industry and the biotech companies, the veterinary industry, and the environmental involved companies, that could offer also solutions, decarbonation and depollution. And I would like to promote also this private-to-private One Health approach, because this is source of competitiveness, innovation that we should also think about in the plan, the Belém plan, and that is something that I will organize in Lyon, the industry meeting the industry. Okay, let's move to now Nancy Alberto. You are representing the international organization FAO, the Food and Agriculture Organization, as Deputy Director of its Food and Nutrition Division. And you have more than 15 years of experience at the UN, also at the WHO, the World Food Programme. So your comments are also very interesting and important.
Thank you, Jerome. And distinguished colleagues, it is such a pleasure to be here representing the Food and Agriculture Organization of the United Nations and the larger constituency of the Initiative on Climate Action and Nutrition, or the ICAN. The ICAN brings together FAO, WHO, the United Nations Environmental Program, some civil society partners, the Global Alliance for Improved Nutrition, the Scaling Up Nutrition Movement, and others, along with countries underneath the vision of the COP27 presidency of Egypt to push forward at scale integrated actions for both climate and nutrition. FAO and the ICAN are part of ATACH because, as we've been discussing the past 2 days, we clearly cannot distinguish between planetary health and human health. They go together. And when it comes to both planetary and human health, it starts with good soils, good production, good food, and good nutrition. So we think that it is important to consider, in the context of a climate and health discussion, what it means to have those integrated actions for climate and nutrition. And the evidence indeed shows the potential for integrated actions to provide efficient multi-impact solutions to numerous global and national priorities. FAO is committed to the ICANN, and we're committed to ATACH, because through reaching our vision of a world where everyone is practicing healthy diets from sustainable food systems, we recognize that we can be contributing to one of the most impactful solutions for health, both human and planetary. Now, of course, when we're talking about healthy diets and we think about the health, the human health side, we all know the importance. We don't have to look any further than the fact that diet-related non-communicable diseases are the #1 killer worldwide. Additionally, we also need to remember that undernutrition continues to be the underlying cause of nearly 50% of all child deaths in children under the age of 5. Now, something you might be less familiar with is the planetary health side when it comes to healthy diets. Food systems currently contribute to 1/3 of greenhouse gas emissions, as well as 70% of freshwater withdrawals, 80% of deforestation, and they are the #1 contributor to terrestrial biodiversity loss. But it's not all bad news, because that means solutions across food systems have a huge mitigation potential. And the IPCC 6th assessment report concluded that shifting to sustainable, healthy diets has one of the highest potentials in all of the land use sector. Nonetheless, just shifting to healthy diets is really just a privilege, because roughly 1/3 of the population around the world can't afford a healthy diet. So we at FAO are working as a systems approach to try to make those food systems more equitable so that we can increase the availability, the accessibility, and the affordability of healthy diets for all. And we see that the ATACH is a critical platform for bringing together people like the Food and Agriculture Organization working in that food sector with you, the health sector, with the environmental sector, and putting people and their health in the center. The ATACH is a fulcrum for innovative partnerships for us to all work together for one goal. So let me just conclude by echoing something that I heard yesterday from the Minister Assistant, Dr. Hassam Abdel Ghaffar from Egypt, when he said we need synchronization. We need the health sector, we need WHO, we need the food sector, we need FAO, we need ATACH, and we need ICANN, because together we can make a difference. Thanks.
And be sure you have the full support of France, which welcomed the Nutrition for Growth Summit this year, and we should also have a follow-up action together. Everything starts with healthy diet and nutrition and equity in that field. And the climate change has an impact, of course, on these objectives. So let's move now with the final, well, last but not least speaker, Cecilia Sorensen. I would say, Cecilia, you're representing the academics, and this is a very important stakeholders also for the implementation of the future Belém Action Plan. You are the director of the Global Consortium on Climate and Health Education at the Columbia University. You are also a specialist in emergency medicine and in environmental health. So the floor is yours.
Thank you so much. So it's really a true honor to be here today representing the Global Consortium on Climate and Health Education as an emergency medicine physician and on behalf of academics, researchers, physicians, nurses, frontline community health workers. The GCCHE is a leading global network advancing climate and health education. Together, we unite over 400 health professional schools across more than 70 countries while engaging 150 governmental and non-governmental partners. Together, we are serving over 300,000 learners worldwide. As we approach COP30, we really stand at this critical crossroads. The Paris Agreement, including the new global goal on adaptation and its health indicators, has made it clear. Building climate resilience in health systems is not optional, it is urgent and it is mandatory. Health professionals are the first and the last line of defense to protect everyone from climate and health harms. And this starts with capacity building. Without trained health professionals, no climate adaptation plan can move from aspiration to action. At GCCHE, we are proud to support countries in meeting these global goals by mobilizing every level of stakeholder: health faculties, students, researchers, ministries, and most importantly, communities. We have strategic work streams across 5 main pillars of action: institutional engagement, professional training, strategic and technical consultancies, policy and advocacy, and last but not least, community capacity building. We stand ready to assist ATACH community members in meeting capacity building goals in line with the Belém Action Plan. Within each pillar of work, we have developed tools and frameworks needed to support countries and help them achieve their targets on capacity building. Our approach is grounded in evidence-based science, practical experience, and of course, partnership. We find it is essential in these times to be harmonizing our approach to capacity building and training. Because adaptation is not a one-size-fits-all program, we work to regionally specify and culturally integrate our programs to meet local needs. In just the past 3 years, we have trained over 40,000 health professionals from 167 countries across 5 of 6 WHO regions in partnership with more than 100 institutions, including academic centers, government agencies, and NGOs. We aspire to train an additional 200,000 through our soon-to-be-launched Grand Challenge to train the health professional workforce. On the ground, we are working to create train-the-trainer programs, we are working to build train-the-educator programs, and working to really equip the last-mile health professionals with the tools and skills that they need to address the health needs of the most affected populations. We are delighted to support the Belém Health Action Plan. We applaud that this plan emphasizes the health sector's role in adaptation through surveillance, evidence-based policy, capacity building, and innovation. The GCCHE is committed to aligning our tools and trainings to help countries implement this effectively. Yet this is just the beginning. Preventable deaths and health challenges linked to climate change continue to grow, and we must act now. We call on ATACH partners to urgently integrate strategic policies and action plans at national levels that catalyze capacity building programs across their health workforces, and we are here to help. This must be done with adequate funding, and this must be done with the input from communities. Finally, I warmly invite all ministries of health and all ATACH partners to join our upcoming training, Scaling Up Adaptation in Health Systems Across the Americas, which will be launching this September in partnership with WHO, the Pan American Health Organization, the Inter-American Institute on Climate and Health, and Health Canada. So thank you all so much. Let's ensure every country is empowered, every health system is protected, and every community is healthy. Thank you.
Thank you very much, Cecilia. Very important 2 roles for the universities, academics, and first the training, of course, but then the research and studies and evidence we need to support our actions and to evaluate also the action that will be implemented through the Belém Action Plan. I want to make an important comment because this key player has not been mentioned during the last 2 days. This is the WHO Academy. The WHO Academy was inaugurated last year in December. It's based in Lyon, but it's WHO initiative. We need all of you, universities, Academy of Medicine, to produce the corpus, the pedagogic corpus we need on climate and health to feed the academy. Also with a language issue. We should make sure that no one is left behind due to language barrier. Most of the documentation are developed in English, but you are here to develop documentation in Portuguese. We are here to develop documentation in French for training all these countries, civil society actors that do not understand English, but will benefit from what you produce as academics and Academy of Medicine, for instance. Very important, the language barrier and how the Belém Action Plan will address this as well to make sure no one is left behind. My conclusions are brief. This diversity we've seen today is extremely important for implementing the Belém Action Plan for ATACH as well. There are a win-win relationship with ATACH we could develop together. Diversity is a source of success. We can see here from your intervention, and this should be mentioned in the Belém Action Plan to promote synergies and coordination of all actors. Thank you very much.
Thank you very much, Jerome, and all our panelists. I'd like to invite you to give them a quick round of applause, and maybe if you could go to the center, I think they want to take a photo of you. And just a few quick concluding remarks as we close this ATACH session. I hope that you have found it interesting. I certainly have. I think we have seen that there's a rich body of work already happening in climate change and health, that countries are really committed to driving this agenda forward, to tackling the challenges, but that there are also lots of opportunities, lots of solutions, lots of work already happening. And ATACH provides a space where we can share those experiences. We can see what good practice looks like. We can energize each other, and we can work together. And we also have not just the countries doing this, but just many partners supporting countries, communities, a global agenda, a regional agenda, at everything, at different levels, bringing expertise, training. And so we've heard so much about what's going on. And we've even had attempts at creating a vision for what a climate and health world or adapted world looks like. And I hope you find that also motivating, because we can get there working together. And platforms like ATACH supporting action, supporting a focus on implementation, a focus on how we do things, I think is just a really valuable contribution to furthering this agenda, the many commitments we've already entered into, and this new Belém Action Plan when we agree it in November. So I hope that you enjoy the rest of your day and the rest of the conference, and I'll see you around. Thank you.
Senhoras, senhores.
Ladies and gentlemen, now we start the session 3, social participation on climate and health. This session will be moderated by Jerry Eichmanns from the Pan-American by PAHO. We start with the perspective of Jerry Eichmanns about the development of institutional mechanisms and social participation and the climate governance and health from the local to the global. There was a roundtable. We have the following speakers, which I invite to the stage. Weibi Tapeba, Indigenous, Agency and Community Experiences on Climate Response. Marion Sampaio, Environmental Racism and Climate Justice. Bianca Carvalho, Representative WHO Youth Council, about youth participation. Dauda Diouf, Foundation S, about private sector support. Fernanda Lopes from the Brazilian Association of Collective Health about the NGO's role in public health goods. The PEBA secretary is coming, will arrive soon, as Fernanda Lopes, and as soon as they arrive, they will join the stage. After the presentation, we'll open a Q&A session of 40 minutes with the audience. To subscribe to it, please use the QR code that will be shown on the screen. The session will be closed with the final considerations of the moderator. Jerry, you have the floor. We announce again the secretary to join our honor table. Welcome, secretary.
Afternoon, good morning. It feels like afternoon, but good morning. We have had such a rich discussion already this morning, so let's continue with a fantastic panel. I'm sure this is going to be one of the most interesting ones. So we're going to talk about social participation. And social participation is absolutely essential, also very much highlighted in this Belém Action Plan that we're all discussing and that we want to advance together. I really want to congratulate again Brazil for having this vision of putting health equity and climate justice at the center as a cross-cutting team, as well as leadership and governance on climate and health with social participation. And we know those two are intrinsically linked. No, we cannot think about equitable solutions without the participation of everyone, without the participation exactly of the people who suffer the most of what's happening on climate change and health. No, we're talking about meaningful participation, not just getting opinions, meaningful participation where we really listen, where we really value, where we really use and work together, to build collectively, not token participation. This is really, really important, where every voice counts, where every voice can be expressed, and as I said, where we are listening to them and take them seriously. So, again, the global leadership of Brazil is again shining in this. Thank you. We're all convinced here, you know, climate change is a global health crisis. We don't have to talk about that, we know. But we also know that every crisis has an opportunity, and of course it does. But every crisis also has huge risks. No, huge risk of making the enormous existing inequities that we have globally, no, that we have in every country, that we have between countries, that this crisis makes those inequities again larger. And I think this is something we really, really need to watch out for. And I want to give the example of COVID. You know, I think there are populations in situation of vulnerability. They could not comply with the standard public health measures. They could not wash their hands with water and soap because they simply didn't have water. Or they could not stay at home, you know, with the entire family, or work from home because there were no computers, the house was too small. So I think if we do not remember that and think every time when we make a public policy that relates to climate change, that relates to public health, if we do not from the very beginning take into account this health equity and this equity approach, now ensuring that the policies adapt to the conditions and to the situations in which people live, to their territories, we will create gaps that are going to be bigger and bigger. And this is something we really need to avoid. And what is absolutely crucial for that is that we work with the communities to understand what it is that we need to do differently. They know what works, they know what doesn't work. And so that's why this panel is so crucial, but we're going to listen to the people who live this on the ground, who work this every day, and who are going to be able to make this social participation into something that really is going to add value in this whole process, as something central, not something on the side, not as an afterthought, but something central to the agenda. we need to talk about what kind of mechanisms are necessary to allow for this. We think at local level, we're managing more or less, to get the voices in. But what happens at national level? What happens at the global level? Where are those voices in the big global debates where it comes to the big global policy making? So this is also what we're going to really hear from this panel. We've been hearing about this global mutual. I'm not the best one to pronounce that. Mutual. I love the concept, but the pronunciation I have to practice. No, which was launched by the president of the COP. No, which aims to build this chain of mobilization and to turn climate commitments into action, to mobilize civil society organizations worldwide to integrate local actions with global climate goals. And really recognizing that responding to this crisis requires a collective effort, and and to move also those negotiations, the talk, the paper, into concrete action. So social participation should not and cannot be at the margin of our efforts. It cannot be something on the side, and that's why I'm so pleased to see this integration of social participation as across the entire Belém Action Plan. It works with surveillance and monitoring. It's not something independent. It works with development and the implementation of climate and health policies. It works with innovation and production. In all of those areas, we need social participation. We need an equity lens. We need to make sure that we are going to move along. So I'm coming to the point, which is, of course, the most important one, is ask our panel. You're going to have a big task. So how are we going to do this? How are we going to ensure that those voices are being heard? How are we going to ensure that this participation is meaningful, respected, sustained over time? And how do we bring the voices from the local level up to national and up to the global level? So I have the privilege to lead this wonderful panel that brings together different actors, Ministry of Health, community leaders, grassroots movements, indigenous peoples, academic institutions, and private sector. We will hear about barriers. We will hear about facilitators that promote social participation in the decision-making processes on climate and health. We will hear real-life experiences, the challenges, and we also hear what needs to be done to overcome them, to make policy-making processes more inclusive, more equitable, not only at local level, but also at national and global level. So with that, I'm going to ask first the first speaker to come up or to take the microphone, whatever you prefer. Marian Sampaio, the co-founder of Perifa Sustentável. So please take the floor. Thank you.
Well, good morning, everyone. My name is Marian Sampaio. I will be delivering my presentation in Portuguese because it's my native language, but but I have some slides in English to help guide and include everyone in the room. So I hope this creates a bridge between languages and territories too. Então eu vou começar.
So start to doing my self-description. I'm a black woman, a dark skin. I have braces on my hair. I wear glasses. I also wear makeup, red lipstick. My outfit is red. Good morning. It's a pleasure to meet you. And mainly to be here today at this global conference of climate and health, talking about territories that are most impacted and many times are not present on this table, on this sphere of make decision process. So this is me. I'm a confider, executive director of Perifa Sustentável Institute and president of the Brazilian Environmental Education Fund, where we engage the youth that's black from the periphery, that's going to report its reality, that live on favelas and communities around Brazil. We are headed in São Paulo on Brasilândia communities, but we work all around Brazil, extending, broadening this peripheral concept. And I used to say that on the international scenario, we have this periphery that's a lot of things, the global south, Latin America, the African continent, the countries that are on development, the less developed countries, and the center inside this conception that would be the global north. So thinking about that, about sustainability, Brasilândia, Brazilian favelas, and other affected territory, it's about this double context, the local context, and around Brazil as a developing country with several challenges that we need to overcome. And the Fundeia Fund that on the coast of São Paulo, and we created those bridges. We work with advocacy, education, and adaptation projects. When we think about this climate change fight, we need to ensure that the voices are represented, and we already developed many solutions through territory, so we need to think about adequate funding and tripartite between private, third sector, and public sector, so those initiatives on the axis of climate adaptation would be valued through these communities. I have been participating on the Conference of Climate Change from UN and for some years, and preparing this youth and the community leaders to occupy this space as well regarding negotiation, because we know that the popular participation spaces are important, but on the make decisions sphere, that's going to happen, and we need to occupy this place and dialogue with these entities to overcome those barriers of languages, finance. And I'm very glad to go to a conference, and I hope to represent on the COP30 level and to see people like me, youth, indigenous, black people from traditional community. We have 28 recognized communities, so we have other groups, and every time more to realize that this representativeness aligned with the policies is becoming a reality. So one of the things that I would like to mention is that when we think about climate crisis, we don't think only about an environmental crisis, but a health crisis, and something that's linked with the several inequalities that we already we have been facing by year. Climate change come to put that in a more severe way and produce other ones. So when we think about this link between climate and health, we know that 4 billion of people faced extreme heat events like heat islands between 2024 and 2025. When we think about that, we think about extreme cold and extreme heat, the floods, the droughts, all those issues, and how the climate crisis reaches vulnerable communities where the state cannot act properly. So we have 500,000 people that died because of heat waves and extreme events, so we have to consider that. And they not only talk about the territory, but about the composition that us from the social movement call gender, race, and territory. So we have the women as the most affected, and the black people, indigenous people. We have a very high component of racism linked to that. So we know that the black communities from Global South, they are going to face 3 days of heat waves than other white populations that usually live in areas that has a better adaptation to climate crisis. So we also got an exposition to pollution and other components. And regarding that relate to health, we don't have good sanitizing system. We have people that live on these places, and we have these points to discharge waste. So if you don't have selective waste picking, we'll have floats, will be susceptible to diseases as well. So that's why we also reinforce that climate adaptation is not a luxury, it's a right and needs to be faced as it.
Climate adaptation, starting from the communities who have already been working for this, whether through the citizen production of data or renovating schools, buildings, other areas. And we've been doing more. Perifa Sustentável, for example, installed a meteorological station in Brasília to measure the rain, to see how much the temperature is going up, to use this as input for advocacy that we carry out with the local government. So if civil society has produced data, when we think of the government and other organizations that have a lot more financial and technical ability to do this, we waste a lot of time if we don't look at our communities as a great power for creation that also needs to be assisted, especially by the public sector, because that's the function of the public sector. So these are three founders of Perifa Sustentável. I'm Mahaya, Amanda Costa, and Gabriela Alves. So we're in this struggle like many other communities who do this work. We say that our great mission is to democratize the climate agenda, the discussion about the climate crisis in Brazil and in the world, thinking from this place of the communities and peripheries and the slums. And we've been working with other organizations working in these fronts, especially the population's incidence on climate change. So population not only suffers, but it can have an effect on strategies and policies and can bring good ideas, and not only based on our perspective, but making it so it makes sense to other people too, and other projects on the territory. So this is a short sample of what we've been doing, whether by producing knowledge through international papers or writing for local newspapers and activating this network of territories, inciting in the COPs and the SBs, and especially working as a network jointly. Synergy should be a work of order, a word of order when we think of fighting the climate crisis and how we can improve these people's access to health. Synergy among organizations of the third sectors, also bodies of the government who should work together, the Ministry of Health, Ministry of Human Rights, Education, Indigenous peoples. We've been doing these synergies, but we can improve always. And we always reinforce that when we think about the climate crisis, if we're going to talk about justice, and if we really want to solve the crisis in which we are, there's no environmental justice without thinking about racial justice. There's no possible struggle or solution for the climate crisis without considering the voice, the strategies, and the harm suffered by the most impacted populations. Thank you very much. Thank you very much. Fantastic.
The voice and the power behind this fight for climate justice. Thank you so very much. So we're now going to the second speaker, who is the Secretary for Indigenous Health from the Ministry of Health in Brazil. I'm going to pronounce this wrong again, Webe Tapera, and he's going to talk about indigenous agencies and community experiences in climate and health. Bem-vindo.
Bom, muito bom dia a todos.
Good morning to everyone. First of all, I'd like to identify myself. I'm Weber Tapeba. I'm an indigenous person from the Tapeba people in the semi-arid region in the northeast of Brazil. I am currently Secretary of Indigenous Health of the Ministry of Health. We have an important characteristic that we plan, coordinate indigenous health policy through our 34 special sanitary districts. We operate and implement these policies in our indigenous territories in Brazil. There are more than 305 people, great linguistic diversity, which is a heritage of the Brazilian state. 172 languages are spoken by our peoples, and we have more than 100 indigenous peoples in our countries who are in a situation of voluntary isolation. And we maintain a policy of protecting these territories so these people can continue maintaining their autonomous systems, their way of life, their self-sufficiency without the interference of the state. Therefore, the state must guarantee the preservation and maintenance of the people as they are. I'd like to greet all of you. You're welcome, representatives of institutions, governments of other countries that are here. It's a pleasure for us in Indigenous Health to also be able to participate in this discussion involving needs and the involvement of social participation in the climate emergencies in our country and in the world. In the last few years in Brazil, we've been facing climate crisis where the indigenous peoples of Brazil for a long time had been denouncing violations of human rights, also focusing on environmental issues, stating that global action would be necessary to allow our common home, our planet, to remain standing. And the main focus of the indigenous peoples in Brazil is the need to guarantee the forest standing and a policy for regulating territory so these communities can maintain themselves firm, autonomous, far away from violence, persecution, and massacre. We are living in a country where in the colonial period, information points to a presence of 6 million indigenous persons on the territory. After the contact, we had a drastic reduction to approximately 400,000, showing that the history of Brazil was based on massacre, ethno, and genocide. So we're at a time when Brazil is getting in touch with its ancestral roots. And the last data from the IBGE census, or official census body in Brazil, in 2010 we had a population of approximately 800,000 indigenous people. We were able then to elevate it to 1,600,000. In our country, the birth rate among the indigenous populations is the highest. I would like to point out that our government under President Lula and Minister Nizia and Minister Alexandre Padilha, we participated in the 67th Health Assembly in 2023, and Brazil led a process that led to the approval of the first resolution, which brings the topic of indigenous health as a global priority. So in that year, 75 years of the foundation of the WHO, we had the first resolution stating health among the indigenous as a global priority. The resolution has several points. The most important is that the member countries of the WHO take on the commitment to create and institute their national plans of indigenous health. Here in Brazil, we have a subsystem related to the unified health system, which I believe is one of the greatest policies of social inclusion in the world. It's called SUS. And in the subsystem of Indigenous health, we have a national policy of health care for Indigenous populations. It focuses on primary health care, but it has many elements that need to be perfected. So in this line, we have carried out 5 regional seminars. Our intention is to guarantee that in a pact, the states and municipalities will also be able to be co-responsible. And in this topic of climate change and climate emergencies, we have a plan. We first instituted a committee that cares for climate emergencies. I come from a semi-arid region. I came with a companion from my state, Teca Potiguara, who lives in a community called New World in the state of Ceará, where a cistern with 52,000 liters of water makes a huge difference for families who know the value of water in an area with little rainfall, and others who before had a lot of rain are now facing this problem. So she said there's an exchange now between those people who are used to droughts, helping other communities deal with this reality. Our peoples and communities are perhaps the public most affected by climate change, and they are the main defenders of the environment, of nature, of Mother Earth, as we call her. So besides the creation of the Committee for Responding to Extreme Events in Indigenous Health, we are preparing for a first seminar at a national level about Indigenous health and climate, to work on resilience based on the traditional knowledge of Indigenous communities, to point out paths and contribute to this agenda that needs to be international. We also have the intention to strengthen the new national policy of health care for the Indigenous peoples, including Indigenous medicine, recognizing those who detain ancestral and traditional knowledge, such as our shamans called pages, who have this spiritual ancestral knowledge of medicine, and who also have to have a space in this structure of Indigenous health policies acting and supporting our teams who work in our territories. It's in the plan of the Ministry of Health of the Brazilian government and our secretariat to launch in November at COP30 the first national program of Indigenous sanitation in our country. We have a diagnosis that's very concerning that points out that 72% of the indigenous territories in Brazil don't have access to drinking water. Territories are being greatly affected by mining, by illegal mining, which uses mercury, and exposure to mercury has created very serious health problems, children being born with neurological problems, women with problems during pregnancy, and also pesticides, because monoculture and agribusiness has also been noxious for the indigenous populations who are ceasing to be self-sufficient in terms of access to drinkable water. So the intention at COP30 is to bring in other institutions, international funding, private initiative, and other ministries to support this action of the Secretariat of Indigenous Health. Last information looking at COP30, our intention of the Brazilian government is also to announce the first reference center of assistance to people exposed to mercury. So we want to implement CRIPAM. The idea is that it will be implemented in the state of Pará, which will host COP30, and the state of Pará is the one with the greatest problem of exposure of people to mercury. So I wanted to bring you these efforts we're making so we can have climate resilience in the international field. We need to speak to those who bring and translate ancestral knowledge passed from generation to generation. So I invite all of you to hear the original peoples, more the indigenous peoples of Brazil and of the world. Thank you very much.
Muito obrigado. Muito obrigada. Very, very inspiring talk again. Talking about the realities of the people and talking about what's possible in a country that does put its efforts behind what needs to be done, and also learning from this indigenous experiences so that they can also serve as examples for the world. Thank you so very much. So I'd like to now call on Bianca Caballo, who is a WHO youth, a part of the WHO Youth Council, and she's going to talk, of course, of the perspective of the youth, but also of gender. Thank you so much. Welcome.
Bom dia.
Good morning.
I'm part of the WHO Youth Council. I'm also Brazilian, so I'm going to take this opportunity to speak in Portuguese. So thank you, and I'm sorry for those who didn't speak Portuguese.
First of all, I would like to briefly introduce the Youth Council of WHO, compounded by several institutions, student and youth institution. We have a picture of the current Youth Council from the mandate 2025-2026. Us from this council, we have participations on several places around the world. We have been several organizations, the medical and non-medical ones. And we, at this moment, so we have 3 working groups about education and health literacy, planet health and accessibility and equity. So just to give you an overview, we have regular meetings with Dr. Tedros, and we work engaging how the youth agenda could bring the news and updating to health from the youth perspective. So I'd like to start talking about how the climate change affects youth. We live a planet crisis that's also a health crisis. Climate change affects the air that we breathe, the water that we drink, and the food that we eat. So the health system in which we depend on. So those impacts are not felt in an equal way. Women, indigenous people, and people in vulnerable situations, and youth, especially in the global south, are between the most affected, and still we are the less represented in make decision spaces. The youth, not only the future, is the present, and through the WHO Youth Council, we work to ensure that the health policy make decisions, ensures the possibilities of the youth, and we bring a concrete experience of the heat waves that affect the schools, the floods on our communities, and the climate anxiety that affects our mental health. I myself came from Baixada Fluminense on Rio de Janeiro. I was born and grew on Baixada Fluminense neighborhood. So I lived with the pouring and floods and lost everything with epidemics of dengue fever. You always try to find spaces that has this mosquito threats, so it's important to have social participation, not a luxury, it's a right, and it's essential to build fair policies that should be efficient. So we also have to mention in climate crisis, the gender issue. They are profound interconnected. So according report to 2050, climate change can push 150 million women to poverty, 60 million more than men. Extreme events like floods and heat waves limitate the access to basic resources and increase the work loads non-remunerated to women. The climate crisis increase the violence based on gender and reinforce unequal rules and discrimination, especially in emerging contexts. Here, I would like to show you some data. 80% of people that are on moving situations because of climate change are women. 2 million of women and children die prematurely because of disease caused by air pollution. And the impacts of climate change on genders, on health of the genders, are seen on the sexual health. Stress caused by extreme temperatures increase the level of cortisol and could take to the increase of the blood flows on the placenta and cause diseases on women. So that's something that we need to discuss. We have to discuss climate change with the gender condition as well. And talking about the youth part, we have to have clear that climate change and health are also linked to the intergenerational right. The decisions that we make today will affect the youth very briefly, very soon. Climate crisis is also a just crisis between generations. The decisions that we make today will shape the well-being of the future generation. Our generation feels the impacts of climate change, and we are going to see the future pandemics, the increase of air pollution, and the increase of the military insecurity. So we demand responsibility and a long-term view. We are not asking to be heard. We want to be included, financed, and recognized as partners on the construction of the future. This way, I would like to thank and congratulate the approval of the WHO National Action Plan about climate change and health. It's a landmark, strategic landmark that guides country about how to extend the health response to this crisis. The first resolution approves on WHO about climate change and health, and this plan was proposed for a group of countries from the global south. So I'd like to congratulate Brazil because it proposed this plan, and it's fundamental and it's based on equity, gender response, and it recognized the one that less contributes climate crisis as youth and marginalized communities and are the most affected that should be included in a meaningful way and to build solutions. To finish, I would like to call to action. We have youth councils based, I'm sorry, I'm a little bit nervous. We need more young councils focused on health, and we need more data about gender and how it's affected by climate change. Here, I would like to show some examples of how youth councils focus on the environment are making the difference. We are the futures. We need to be heard, and we need to have our ideas discussed. The Youth Council of WHO is inspired by the Youth Council of Denmark in Poland, and those councils interact with the ministries of environment, and it's very important to be adopted by all countries. So we have to deal with the consequences of the decisions made today. Thank you.
So much for this very fresh perspective, very needed perspective of having youth at the table. No, youth really having a voice, and also for putting the dimension of gender equality very strongly on the agenda. Thank you very much for that. And yes, intergenerational justice is extremely important. So I'm going to now invite our next speaker, Dauda Diouf, the head of Climate Action and Health Resilience Foundation, who's going to speak about leveraging the support of the private sector. We're really looking forward to that. Thank you. Please, welcome.
Thank you very much. I have a double hat. I come from Senegal. I am based in Paris working for Sanofi Foundation. And my colleague Tatiana, who was in the panel, talked a little bit about the commitment that Sanofi has made to support climate adaptation and health resilience. I have to also to disclose, because this panel is really about those at the front line of the climate and health crisis. But I have to disclose that myself, coming from Senegal, the house where I was born doesn't exist anymore. It has been swallowed by the sea. The playground where in my coastal villages has disappeared. And many houses and many fields for agriculture has been also sanitated because of the sea is rising in my own village. So I am also speaking from the perspective of someone who has lived the impact of climate change on health personally. We are the philanthropic entity of Sanofi, and we are committed to and really dedicated to supporting health resilience and climate action for the most vulnerable population in low and middle income countries. We do so through really supporting and investing in locally led adaptation. But why is that? A farmer group based in Paris has also decided to support, fund, and invest into locally led adaptation. It is very important and maybe relevant to this panel, because the simple truth is that the closest people to the problem are the closest people to the solution. So this being said, we need to recognize that communities who are facing every day extreme heat, are facing the outbreak of infectious diseases, who are facing scarcity of clean water, who are also who has been dealing in Uganda, in Malawi with cholera outbreak. They don't need to be told what the impact of climate change is. They live it, and they most probably know what are the best intervention and best action in response to those crises. That's why we have decided to focus our support in really enhancing the role of communities and the role of local organizations in responding to the health crisis that is related to climate change. And I think since yesterday, we are a little bit shy of talking of the real problem, which is money, right? I was expecting that, funding, that's why I'm here. Okay. We need to talk about funding. We need to talk about money. I was with my friend Desta from AMREF, and a key colleague also from Wellcome Trust, with a group of countries. And one gentleman from South Africa stood up to say, you guys, show us the money. Show us the money. What communities need is funding. And they need support from international donors, from philanthropic organizations. They need also to be involved in decision making. I think many people have said it. But we need also to be very attentive to the message from Dr. C, the Minister of Health, and from our colleague from Nepal, from Bangladesh and Malawi yesterday in the working groups. They're saying they can't anymore afford to spend 4 years to get funding. It's either we are not very bold, or we need to be more creative in delivering funding to those who are in need. That's why at Foundation S, we are really working closely with our partner, the Global Fund, Wellcome Trust, Rockefeller, AMREF, and many other organizations to really fund directly communities and local organizations that are at the forefront of the climate and health crisis. And we do it through catalytic funding, and catalytic funding has been also one of the illustrations of what it does to embark into the 4 Ps, which is private-public philanthropic partnership. And that's what Foundation is about, pushing and enhancing public-private partnership. Participation is also for us, and social participation is also for us, bringing those who are not the traditional donors. One of the traditional donors and key players are also local municipalities. I can see the city of Paris here, and we need next time to bring more of those donors who have a strong tie with the local communities, who can understand and act rapidly in supporting the local actions. For me, the most important message for me is that we need to be creative and use the innovation to be able to fund the climate action and climate adaptation and health resilience in a way that is flexible, that is accessible, and that is friendly for community organizations. If we hold in our offices the funding saying that we are investing, we are not. It's necessary to fund, but we shouldn't fund only projects. We should fund local leadership. What should we fund? We should fund also participation of communities, as you said. We should fund also innovation and implementation of what works. And we should fund also local solution at scale and with speed. And I can borrow a word that's from Alan Dango, who was saying in an intervention during the World Health Assembly that we need to bring also a certain sense of urgency. And this is what the minister was saying. We need to be rapidly and acting fast. That's what communities need. They know what works, and they need to be supported to scale up. That's what Sanofi and Foundation S is about, and we are committed to. And today we are supporting directly, I can say, from Paris to Burkina Faso, from Paris to Mali to Burkina, in 26 countries, locally led climate adaptation. And once in a year, we bring everybody together to showcase what are the local solutions that works, that only need more funding to be scaled up and to respond effectively to the crisis that is posed by climate change to our communities. I thank you very much.
Thank you. Thank you very much. And it's very, very good to hear that the finances are going, the money is going directly to where it matters. It's where people live, where they know what the solutions are to the problems they live. Thank you very much, and let's hope that this is a movement that really can take off. So we have had a set of fantastic speakers, but now we still have one more. So I'm going to invite Fernanda Lopez, epidemiologist, PhD, and Master in Public Health from Abrasco. And she's going to talk about building public health goods as an NGO. So welcome to the floor, Fernanda.
Bom dia a todas as pessoas presentes.
Good morning to the audience, and thanking this invitation to be here today and with this challenge to talk about to build good public health goods via NGOs to protect the physical and mental health of individuals and communities via NGOs. Care technologies guided by different matrix and knowledges and practices, not only the Western ones. To talk about it on this context, it's very important to show the elements that take us to think while social movement, while activists on health by climate justice, racial and gender, to think about what moves us to be here at this moment today and overall to build plans for the futures. Climate change, the environmental disasters, the scarcity of resources turns the inequalities harder, as we know and as mentioned by all the people that came before me. It becomes the inequality severe. So that's why it's important to show intersections between genders, race, and health. They were already being done several statements. They're urgent before I speak. Black populations, indigenous and peripheral populations, and its majority women, are vulnerable to the impacts of climate change. Those groups face high exposition to disease, malnutrition, thermal stress, while have less access to health services, social protection, reflecting the legacy of racism and colonization. According to the latest demographic census here in Brazil, 1,077 million people live in urban areas, around 87.4% of the population. 55% of Brazilian population self-declare black. Around 112 million and 700,000 people. The majority of this population are women. Black women are 28% of the total of population, around 60 million. They live majority in urban zones, and as black men are underrepresented in favelas communities, urban areas, communities, 2.9% areas that by its natures presents a major probability of adverse events that could cause meaningful damages to people, goods, services, resulting in economical and social prejudices. Those areas of urban risk areas are more vulnerable to the impacts of climate change. The climate crisis, extreme events, the floods, landslides, droughts, or others had the gender profile as mentioned before. Women, especially black women and from other race groups and poor, peripheral, takes the weight of family care on climate change, limiting its economical independence and political participation. For example, according the Ministry of Agro-Development, 7% of Brazilian aid comes from family farming. The new national program of adaptation to climate change needs to include indicators to monitoring vulnerability of family farming facing climate risk, because women are the ones, and indigenous women, quilombola women and other traditional communities, then the main responsible for the harvest of the gardens destined to feeding. On this sense, beyond the restriction of their economical independence, it generates scarcity, food insecurity on the rural area and also on the urban area. And those actions, this weight, it's under overall on women. The studies of the IALETA Research Institute relate the drought and gender violence. According to the researchers, 72.4% of girls in poverty on drought are victims of sexual harassment on the drought areas of Brazil. Climate change increases the risk of undesired pregnancy, maternity deaths, where services and resources of sexual health are restricted or neglected. In this sense, to build health goods on the context to seek justice, climate justice demands intersectional approach that recognize the overlayers of oppression. The diseases like dengue, measles, and the air diseases are connected to climate change. They intensify its intensity and geographical distribution in urban area. The increase of temperature and the frequency of extreme rains favors the spread of vectors as Aedes aegypti and elevates the risk of floods that spread communicable diseases on the contaminated water, affecting in an unequal way people in poverty situation, children, elderly, migrants, and black people. On the rural area, extended drought damage food security and hydro security, facilitating spread of diseases. Indigenous populations, quilombolas, river populations, artisanal fishermen, and other traditional communities have been affected very often. One that's not mentioned when you talk about heat waves or even floods is the homeless population. In Brazil, we estimate that we got around 335,000 people as homeless people. It's majority black population between 18 and 59 years old. In the past, after COVID-19, major part of the homeless population were compounded by men, older men, but currently we got families, men, women, children, adolescents impacted by the climate events. Climate crisis intensify extreme events like storms, floods, droughts, and got different effects on genders, affecting in its majority women and trans people and other people that receive its income. They work in street contexts. The participation and social control are challenged by excluding structures of power, and so we need to talk about it to build health goods. Marginalized communities, they are the most affected but have less voice on public policies because of institutional barriers, the lack of representation, limited access to the make decision spaces. as mentioned by the previous speaker, centralization of the power, the inclusion of these groups on the councils of public policies, on forums, and public hearing, budgets, and other participative mechanisms are urgent, but we need to break the politics resistance, the lack of investment on capacity building, mobilization, training, and diversification of the leaderships is also an investment to the action. We need to extend the hearing, ensuring finances to local organization, and at the same time create accountability mechanism that account governments, philanthropy, international agencies, because the main barrier to establish a democratic governance and participative on this area that connects health and climate and other areas is the intentionality of the groups that have the power to be monitored by civil society. In Brazil, strength the health public system SUS, adequating that to the prevention and health disease, including care with the migrant population, need to be aligned to the regulation of the environmental risk zones and also the interventions, their ambitions in sectors like education, work, income, infrastructure, sanitization and well-being that reduce vulnerability. But to have it, to reduce vulnerabilities and the development would be assumed as a human right, so the next generation have the right to exist and dignity. It's needed to cross-cutting social fights, articulating black movements and feminist movements, indigenous movements, environmental movements, urban and rural ones, to pressures for structural actions, regeneratives, and sustainable. Thank you.
Thank you so much for putting this whole diversity of vulnerabilities and situations of vulnerabilities that affect our action and that affect the effectiveness of our actions and that do impact on equity. And also starting to talk about what needs to be done differently, what needs to change. So, well, thank you so much to all the panelists. I think this was absolutely fantastic, very diverse, very deep, very interesting. And also thank you because you have all kept very well to the time, so we have some time for discussion now. I understand that we could have a QR code where people can ask questions in, so if you can help me, please set that up. So while we do that, so that we can really know what are your questions from the room, I'm going to ask a question, and you all touched on it in one or another way, but what are those main institutional, cultural, economic obstacles that prevent effective social participation? And more than identifying the obstacles, what could we do to break them down? What needs to be done to change the situation? It would be nice if we could have a mic so they don't have to come to the... There are no microphones there, no? See, yeah, we have. Is there? Excuse me. See. So, you want to start? Adelante.
Bom. Well, hello? Well, when we think about the obstacles, and thinking very much from my point of view, from the organizations on the ground and the problems we face related to the climate crisis and health, also economic and institutional problems, and thinking of the organizations that I represent today. When we think about associations, networks, community organizations, we reach an institutional obstacle because many institutions who do very important work have difficulties obtaining resources, obtaining funds, because the great bureaucracy we face. Many organizations only able to access some territorial funds, but they need to prove the year of experience. They have to give special documents, and many of the grassroots organizations face that problem. But this institutional placement has a cost. It has a financial cost, unfortunately. So funding is one issue locally, but also globally, because as our colleague said, we have to focus on funding for climate adaptation, not only from the bias of adaptation. I was in Bonn recently, engaged mainly in the negotiation of the global goal and adaptation. And contrary to other texts where we had significant advances, for example, the inclusion of the term African descent in the text of gender and climate, or even of just transition, we have a great difficulty advancing in the discourse on adaptation, because it seems that all the countries are looking at this agenda, and they're quite right to. And we have a very progressive discourse, however, a great resistance in establishing financial mechanisms that makes this climate adaptation feasible. And after making it feasible, we will have to face another challenge, thinking about each country, how much of this climatic funding will reach the organizations, the collectivities, the communities. So we have to think about how to decentralize these funds. I'm speaking also for Fundeia. We're a territorially based fund. We capture to redistribute and facilitate access in the territory. And in our vision, especially for those who have performed climate action in the grassroots, this is also climate funding made accessible for communities. So access to funds is a difficulty, and also how to think about these international mechanisms in a facilitated way so it makes sense and reaches the communities not only symbolically but effectively. So when we think about places of social participation too, we have advanced in that as Brazil, but we can do much more. So thinking about how we can articulate much more through committees, councils, and even improve the financial capacity of many of them to articulate, to come together, to be present. This is all very important, especially thinking that I see a climate solution very much coming from the integration of our sectors, not only from the public or private sector, the third sector, these sectors working together so we can work in an efficient way on the excess work that a lot of our civil servants are already facing, the place of the third sector, which is not receiving funding, and companies understanding and being held responsible for this crisis, which is very much favored by the capitalist mechanisms. We have to do, and we have to think about this in a very conscientious way as well.
Yeah, great answer. So I'm going to ask the same question. I see some questions coming from the public that also ask maybe some concrete examples of how this has worked. That is also always very helpful. So I'm going to just pass in this order. Yeah.
Well, obrigada pela pergunta.
Thank you for the question. As my colleague said, funding is quite necessary, especially also for the youth agenda. We are young. We don't have a lot of funds to go to conferences here and there. So funding is very important. And listening to, because we youth many times are put in the back of the room and no one listens to us too much, as if we were insignificant. But as I said, it is we who will have to deal with climate change in the future. And we are the ones who are having to deal with the greatest consequences of the climate change now. Also under the agenda of diversity, our young council of the WHO is quite diverse. We have youth from all over the world. We have recently increased the participation of the Global South with the Caribbean and South America, like me from Brazil. And that diversity is important too, because as all the speakers said, we from the Global South are the most affected, so we need to hear the Global South. And it's no use to think of a policy of fighting climate change from top-bottom. Health and climate change requires listening to local populations and having an approach that is bottom-up. So there's no way of thinking of climate change without including young voices and giving importance to the local population, and especially thinking of funding, because it's no use to try to have a plan to fight the climate change, thinking and bringing the voices of youth without funding and without listening to our proposals.
Looking forward, I think, and thinking of solutions. For me, we need to flip from the traditional funding model and really base the funding model on trust, because we need to trust local organizations. And we need to be less sophisticated and simplify the procedures. Simplify, simplify, simplify. And if you have to be sophisticated, let's use the sophistication to find the solution that works. We know that our solution there, local solution that works. Let's identify them and implement those solutions that work at scale. Again, we are talking about climate crisis, but we are behaving like there is no crisis. There is crisis. There should be a sense of urgency. We need to move fast, and we need to deliver on financing to countries. We have heard from the countries. We have heard from the communities and the different groups who are at the forefront. What we need now is really join our effort, change the script, change the narrative, and change the funding model to ones that is flexible, that is accessible. I insist on accessibility. Countries are saying they can't anymore afford to spend 4 years, filling papers and dossiers and having consultants to fly in, fly out. And we have capacities, we have organizations in the African continent, for example, where I am from, who can deliver the technical assistance that countries need, because they understand the context, they understand the reality, and they customize technical assistance to fit the reality of the countries. And we need to have to use our creativity. We need to use whatever we want to use. New technologies, innovation, intelligent, artificial. But the bottom line is that we need to respect where people are, and where people are the closest to the problem and the closest to the solution. And I think we shouldn't be any more shy about talking about funding, and funding should be at the core of the Belém Plan of Action. And I think by working closely with ATACH, we need also to unpack what we understand by delivering funding in a way that it is shift, it is accessible, and it is friendly to fit the reality of communities and countries who desperately need those fundings. Thank you.
Bom, dando seguimento ao que foi colocado.
continuing what was said about the obstacles to strengthen social participation in this topic of global climate change, I'd say that Brazil has a very important fund, which is the Amazon Fund. We consider that other countries who can help more should take more responsibility and commit more and leave just the discourse. We have some international pacts and agreements that are being made, but it's time for the world leaders to wake up because there's no more time. We need to assure that this topic of climate change will be the now topic. We can't wait anymore. I particularly has a very strong criticism to this. We live in a country with other biomes. As I said, I come from the Brazilian semi-arid region, which has a very rich biome called Caatinga, but we don't have funding to assure preservation, conservation, and fostering initiatives of the communities to, for example, fight the phenomenon of desertification, which has reached these communities and displaced entire communities. So there's a great rural exodus still in these regions. Many families and communities have had to move, and this generated a huge problem of social, political, and social environmental disaggregation in these territories. But obviously, looking at funding and looking at our place from which we speak, we need to say very clearly that there are indigenous people who are unable to speak because they can't reach these formal spaces, these institutional spaces, even due to several historical barriers, logistical barriers. For example, the Yanomami indigenous land, which is perhaps the largest in the world, it's located in our country, an area of almost 10 million hectares, much bigger than many countries throughout the world. It's a territory where access takes place, especially through airplanes. Most of the equipment, most of the health professionals or other people reach this land through the air. So it's very difficult to have their participation in other spaces other than those promoted by us, by the government. We have 34 district councils of indigenous health and one national one, but we have to leave our little box of our policies and guarantee that indigenous voices can fly higher and reach new spaces. Obviously, there are logistic barriers, funding barriers, linguistic barriers, which is very important to mention here, because as I said, there are 172 languages spoken, and many peoples are monolingual. So how can we translate these indigenous peoples if they leave the country, for example? And the indigenous populations have forms of representation that are not the conventional ones. Not all peoples have a constituted association included as a corporation officially. So it will be the leader of the tribe or another important person in the tribe who speaks for the tribe. So we need funding and fostering so the actions can reach the indigenous territories of Brazil in general. So to close, I'd like to say that climate adaptation and resilience has to hear those who live in the forests and the territories in several biomes, and this diversity needs to base our climate agenda on our planet. Continuing, we are speaking about assuring the guarantee of a diversity of voices to be heard. And this has to do with the accountability of the different groups of interest, because these are tiers of qualified listening that can amalgamate to bring subsidies for those who can occupy, for example, places of influence and decision making, who not necessarily include community representations. But if they have not been heard, if their solutions, their technologies are not considered in the mapping, this never will be broken. This abyss will never be broken. So the Secretary just spoke about the linguistic barriers, but the climate agenda has a language that is excludant. The health agenda is more popular, but the climate agenda language is for experts. And the translation of these symbols into an accessible language, or rather its non-translation, is also a barrier for participation. So we're talking here about different languages and different idioms beyond the construction of different dynamics. We need to read realities with all the instruments available, who are made available by the academic community, by governmental organizations, by organized civil society, by the organizations in the communities who have another logic, not necessarily the formal logic, but this instrumental needs to be better appropriated by the different actors at stake, because this is missed too. This is also an obstacle. Many times you try to guarantee investment or you seek funding, but if people arrive and they don't understand, it's difficult. And many times these resources are given and these people are invited to be there as if they already had all the instruments to act in defense of their rights, but they don't have them. So it's also a manipulated use of participation, and this is also a great obstacle to guaranteeing participative and democratic governance in this climate agenda. Adaptation and resilience don't exist without solutions coming from the grassroots, without the experiences of survival that are performed by people in the communities, who are in the streets, who are in these spaces, reading realities and building ways of dealing with them, many times in the absence of the state. So I think these barriers, institutional, programmatic, social, economic, need to be better faced by all the groups of interest. It's not an exclusive responsibility of the government, of the private sector, of philanthropy, or even of the third sector. It's a joint collective responsibility in the logic of partnerships for transformation and sustainability.
A way of potential ways of doing this better and to have better, you know, to bring down those very different barriers that are all extremely important. So there's a lot of questions coming in, very interesting questions around financing, around how do we involve even more people from the community who might not be convinced about what's the role of cities and other intermediary political structures. But I'm going to ask another question that also comes through. So you have each 3 minutes max, because we want to avoid that people start to faint here with hunger. What has worked? What has worked? What is your message about what did you do in your organization that you would like people to know and that they can take home and multiply? I would think it would be interesting to hear a bit about that. So, adelante.
Bom, acho que é
So that's a good moment for us to mention about best practices. One of the things that I showed in my presentation, the first thing that I mentioned is that I am at my 50th COP in between many more others forums. We do in a more direct way this training work, not only with the youth, but recently we got a project with the United Kingdom Embassy to train 15 black women and territorial leadership to be on this place. And one of the things that also Fernanda mentioned is the fact that when people finance is hard to have it, but when we favor this representative, so the people can occupy those places, they are out of a clue how to work with it, with that, the terms, how they can work. That's a big confusion, and more than the place, more than confusion and the feeling of being lost, is very important that when we can favor, we make easier leadership, and those kind of people give the necessary tools. So beyond the training courses and thinking in an integrative way, we give a lot of things, psychological support, we give English classes, advocacy sessions. So those 15 women has this advocacy plan through their territory to take that to COP30, a 3-month project that already being implemented. So it's a point that we have this product thinking about how to guide them. So that's a advocacy guideline for women on copy, but we are publishing that our climate just manual. How can we show that with the 3 founders mentioned on accessible language, having questions that we wanted to have the answers when we started. So we have several people graduated and fluent English speakers, but we needed some specific questions to be answered. So we have this manual about copy, which spaces can you act, how to use social media. We are seeing the interesting of the youth and community leadership, and at the same time how to translate to communities what you're living in a copy, like a way of accountability, how to get finance to be on this space, since crowdfunding campaign, projects that exist already. So we got something very cruel from it, and we are publishing that. We are trying to get funding to print and distribute that on the public schools and community associations, but that's a practical example that I want to mention, how to expand those knowledge and give access to this kind of knowledge until achieve big conference like COP, G20, and several other spaces that we know that we can occupy, but it just only to be there. We want to give quality, and that the strengthening of training that we already got. I'll talk about on the youth, WGO Youth Council that give voice to the youth. We have a structure that's very well organized between working groups and meeting with several sectors of WGOs to include the voices of the youth on the policies implemented by WGO and other countries as well. So WGO, Dr. Tedros cares about the Youth Council to have this space on the health area. So we have the working group. We got several activities and works focusing on the voice of the youth, how our voice can change the policies and the discussions debated on the WGO. Dr. Tedros always hears us, our councils, what we are suggesting to future policies, how to implement that, and to hear the voices of the youth, how to create other youth councils in other organizations from the UN systems and other countries. So it's something very inspiring. And I would like to give this incentive to the leaders that are present here, because our voice matters. We are the leaders, we have ideas, we are creative. So I'd like to reinforce this space inside WGO and call to open this space on other organizations. Thank you. Thank you.
Because I was asked once by a woman working on climate, and she came to me to say, my brother, how can you be resilient to hunger? So I don't know whether you are resilient to hunger, but I could not respond, how do you build resilience to hunger? So because of lunch is closed, for me what works, I'm not resilient to hunger, lunch is closed. And quickly what works is that in 2 years we've been able to support 3 million people with our Foundation S. We've been able to channel direct funding to 26 countries, funding locally led adaptation, and it works. What works? Local adaptation, local solutions, evidence-based and tested, community-tested solution works. Thank you.
Para dar sequência aqui, porque
So keep going. In our case, it's because hunger. In our case, thirsty, because water, it turns survive issue, and sanitation linked to indigenous territory is something that we are concerned about it. On my initial speech, 72% of the indigenous territory in Brazil are affected by the lack of basic sanitation and drinking water. The climate crisis and the events that are happening in Brazil made that we could create a committee of response of the extreme events on indigenous health, but we need articulated actions that involves another efforts of other entities, other actors that could be able somehow to ensure to overcome those crises on the territories. We are organizing this seminar that will happen on the Brazilian Amazon to discuss the effects of climate change in the area of health. So we want to launch the Health Indigenous Plan on COP30, and to ensure an opportunity so the private initiative could support and finance. We're going to define and specific finance the creation of a fund to support the financing of this basic sanitation access on the indigenous territories of our countries. And I would like to mention the indigenous health policy is responsible to support the sanitation on the indigenous territory. So our ministry and secretariat have this responsibility that only us are not, we alone cannot implement the water supply around Brazil. That's why we are proposing this plan of indigenous sanitation and water implementation. We are trying to find financing and cooperation. We are doing a lot of things. We present a project. We are waiting to finish its analysis. That is approval of a project on the Amazon Fund. If everything goes right, it's the first time that the Amazon Fund will support indigenous health project based on our territories. We were able, with the support of the Ministry of Indigenous People and representatives of the governments from other states, that's the first time that the Brazilian government created a structure of Ministry for Indigenous Peoples, and we were able to approve a project focused on sanitation on indigenous territories, linked with indigenous communities on border regions and support the sanitation. The plan of acceleration of development, that's a public policies of our government. PAC plan is supporting for the first time the sanitation project, and PRODSUS, a plan to support the sanitation financed by the hospital of the private initiative, support the sanitation actions, focus on training and capacity building of around 7,000 indigenous health agents. So hunger, thirst, and valuing and fostering social participation, the mechanisms that we are putting inside indigenous health. I would like to mention some other best practices, leaders, especially by the leadership of Black women. First one, led by Crioula, Black Women Organization. We over 30 years hosted in Rio de Janeiro, which is Mover agenda of Black women that builds a future with climate justice. So it's a group of proposal based on an extended strategy of hearing, and now is being presented and defended on the different forums of training, community training, or the forums of make decision, the local ones, subnational ones, national and international. National manifestation of Black women that happens now in November here in Brazil, and we'll get 100 women to this space of this city related to what happened in 2015. Have the space extended to discuss the project of country that we intend on the point of view about the lenses of Black women that we intend in a society that fights races and promotes well-being and adequates itself to the climate agenda, looking at processes of fair transition and clean transition and equitable transition, but also of adaptation, and all the efforts They are being made under the leadership of Galedes. It's other organizations of Black women involving different organizations to include the topic Afro-descendant agenda on climate agenda on the international space. The inclusion of not only the term of this agenda, this perspective of racial equality on the climate agenda, but also other spaces beyond the ones that are from the monitoring of the National Convention to eliminate racial discrimination and fighting racism from UN is a result of an action of advocacy led by an organization of Black women. And beyond that, the International Institute, Race, Equality, and Human Rights with Baobab Fund has been working to have financing to extend the access to information regarding climate agenda to Black organization. Its majority with a series of webinars. And the organizations that are represented on the webinars face racism, the impacts of change and climate crisis, but don't take this agenda and don't know almost entirely the spaces of formulation of social participation and the language of this agenda. So those are the best practices that I would like to share at this moment.
So much for 5 fantastic panelists who really inspired us, who really put hope here, who put forward that things are possible, that things can be done differently. And I think really this COP30, that's just a few months in front of us, is really going to be, in a way, a test, you know? Can we really take those voices, all those diverse voices that need to be there to the COP30 and really have a COP that's a COP really about equity, that is a COP that really takes social participation serious, climate justice seriously, and that really brings in all those diverse voices, and not just to listen to them, but to act on them. So again, thank you so much. Big applause for this fantastic group of presenters. Thank you.
Senhoras e senhores, agradecemos a participação.
Ladies and gentlemen, thank you for your participation that collaborates with our event this morning. We also would like to thank to your presence of the audience. I'd like to announce that the lunch is served on the ICB restaurant. We return with the rooms 1, 2, and 3, followed by the working groups at 2. We wait for you sharply. Thank you.
Senhoras e senhores,
Ladies and gentlemen, as it's been said before, we will be starting our last roundtable of the day. Be very welcome again to the auditorium. Reinforce that you maintain your electronic devices on mute. Thank you very much. The roundtable that names Means of Implementations for Adaptation on the Health Sector. To compose the honored table, we invite Bruna Verissimo, Negotiator of Adaptation on the Negotiating Division, Climate Division, from the Foreign Ministry's Affair Ministry, alongside the moderator Manisha Binge, Vice President of Health from the Rockefeller Foundation. Be very welcome to the stage. They accompany the honored Daniel McQueen, Special Advisor for the Gates Foundation. Be very welcome, Danny. Tame Harabi, Senior Specialist in Health for the World Bank. Estefania Jimenez Rodriguez, Climate Change Specialist for the Adaptation Fund. Latsami Infavongsa, Director of the Board of Primary Care. We pass the floor to the table's moderator, Manisha Binge, Vice President of Health in the Rockefeller Foundation. Manisha, the floor is yours.
Thank you, everyone. Good afternoon. I am uniquely aware this is the last session of the day. So with that, hopefully we keep it interesting and let you off for a lovely evening. So on behalf of the Rockefeller Foundation, we are very thankful for Brazil's leadership in bringing us all together to rally around this opportunity presented by the Belém Action Plan. It's an honor to moderate this panel and this discussion focusing on climate and health, focusing on the climate and health adaptation investment imperative, the mechanisms we can use to do this, and the strategies in place to guide us. So this conversation is about financing. So we need to address the elephant in the room. Since the beginning of the year, overseas development assistance for global health has shrunk by at least 40%. That fiscal space will decrease further without a new model for global cooperation and financing. Sitting in the sessions yesterday and today, one theme has remained constant. A collective ambition is unabated. And not only that, we have a model for a new commitment towards global cooperation that brings climate and health together. The scale of what this community gathered here today wants to achieve is immense. It's more than immense. It's transformational. The opportunity for impact is equally transformational. But we won't be able to achieve this ambition without a new model of sustainable financing that provides us with long-term predictable funding that allows us to protect the lives of the most vulnerable communities from climate risks. So let's take stock for a minute. Where do we see hope? We see it in this room. We hear it on the panels earlier today, yesterday. We see transformation happening right now. Countries are putting the work to plan better and prepare. Just this morning, we learned from the ATACH presentations that more than 90% of nationally determined contributions include references to health. So what's stopping us? Of the 50 countries who have developed national adaptation plans that include health-specific outcomes in the last decade, only 21 of those plans actually quantify the financing required to deliver on the adaptation goals. Not only that, it's estimated that only 6% of adaptation funding and only 0.5% of multilateral climate funding are allocated to health sector projects. Yet the need is greater than that. The UNEP program has conservatively estimated an annual need for $11 billion to adapt to the climate impacts, for the health impacts of climate change. If that seems high, the cost of inaction is an order of magnitude higher. So let's take a minute and review what do we know about financing for climate and health, and what's the current state? In January this year, the Rockefeller Foundation, Foundation S, and the Mohammed bin Zayed Foundation, formerly Reaching Last Mile, commissioned a first-of-its-kind baseline analysis on the state of climate and health financing. This is what we found. In 2002, $7 billion were committed to support climate and health action in the health sector, a significant increase from just under $1 billion just 4 years ago. So progress was made. Bilateral donors, those who provide official development aid, increasingly reported making health sector investments that are climate relevant. The share of climate finance targeting the health sector increased from 1% in 2018 to 9% in 2022, the only sector apart from education to see an increase. And we found a large potential to improve health through other sectors. In addition to the $7 billion in direct support to health sector for climate action, funders had committed an average of $13.5 billion annually between 2018 and 2022 for activities in health determining sectors. These investments are in energy, transportation, agriculture, and urban planning, all of whom have the potential to result in significant health improvements and reduce the burden on health systems. This is a whole of society approach to climate and health, a potential model of what the future of global health could look like. The data provides much needed evidence on why the current state has progressed, but is still insufficient. Of the financing that is available, much of it is a form of debt. That has enormous implications on the fiscal health of countries who already are suffering from debt burden. Also, the majority of the financing is not reaching the most impacted countries. Less than 35% of financing from bilateral donors is challenged directly to countries, and less than 50% of overall financing flowed into low-income countries. So we have work to do. And this is a window of opportunity to get that work done. So let's bring the elephant back into the picture. In the 6 months since this analysis that I just summarized was published, we have seen real-time significant disruptions in the financing of development initiatives, and particularly in global health. The OECD projects a 9 to 17% drop in official development assistance in 2025. This comes on top of the 9% drop already seen last year. At the same time, we are feeling the cost of inaction in terms of human life. Health is the face of climate change, and if we don't believe it, historic rainfall is driving outbreaks in infectious diseases. Unrelenting heat waves claim at least 500 million lives a year, but are also affecting 70% of the global workforce, deeply impacting human capital. More frequently, extreme weather events is destroying infrastructure and disrupting supply chains, and at a higher frequency than ever seen before. So it's easy to feel paralyzed, to limit our ambitions and actions because the scale of challenge and need is big. But today's discussion and the community gathered here gives us hope. What we are talking about is not just climate and health. This is about people, this is about lives, this is about the human capital of the future. In a fractured, resource-constrained world, this is the time for institutions and sectors to come back together for bold solutions and have the courage and creativity to lean into action and lean into impact. So with that in mind, today's discussion is both timely and relevant. Through this panel, we are going to dig in on why, the how, and the what of what we need to, one, articulate the value of investing in climate adaptation, making health a pivotal and central adaptation priority. To identify and propose new novel solutions and priority financing mechanisms that not only fill the gap that we have seen in climate and health financing, but the gap at large that we are seeing in development goals writ large. And this is a use case for that. And this is an opportunity for the Belém Health Action Plan to be the investment framework that shows us the path forward and drives alignment across our respective institutions anchored in country demand and country need. So with that, we are going to move to our wonderful panelists and start a series of questions around the three main topics. I'm going to move. So I'd like to start actually with Latsami from Laos. And Laos has been actually a pioneer in unlocking climate finance, being one of the early recipients of Green Climate Fund resources for health. It would be wonderful to hear a little more about the plans and the structure that you put in place as you thought about leaning beyond traditional financing resources into new action and new territories. Over to you. Go ahead.
Okay. Yeah. Okay, thank you so much. So I can say good afternoon, right? Still afternoon. So good afternoon, distinguished colleagues and partners. First of all, I would like to thank you to the government of Brazil, the World Health Organization, and other organizations for this opportunity for us to share our experience and point of view on climate change and health adaptation. So as I talked with our colleagues yesterday, I heard that so many people here didn't know where we are. So allow me to provide a little bit information about my country. So Laos People Democratic Republic, or short name is Laos PDR, or we can call Laos in French. So it is landlocked, is located in center of Southeast Asia. We are a landlocked country with approximately 8 million people of population right now. And we share border with 5 countries, China, Cambodia, Myanmar, Thailand, and Vietnam. So the majority of our population live in rural area. So let me come back to our topic. So in the Lao People Democratic Republic, protecting public health from the impact of climate change is the national priority. So as I say, over half of our population live in, I can say, flood-prone areas that make us extremely vulnerable to climate related to health risks. So Lao PDR is firmly committed to global climate agreement, including the Paris Agreement. So, and our nationally determined contribution, or NDC's second NDC, launched in 2015, 10 years ago. So that which placed a strong emphasis on climate change and health adaptation that was reaffirmed at the COP26. So when we are discussing or talking about sustainable funding, so it's also crucial for achieving our commitment to the NDC and the Sustainable Development Goals. So that's why our government has established a clear policy to mobilize resources for health adaptations, more focusing on, first is focusing on the health component of the NDC. So not just only focus on adaptation, we also focus on mitigation as we finalize or emphasize in the third NDC this year. And also the climate change and health adaptation strategy 2018 to 2025. So we will review it as soon as possible to focusing on, at first we focus only adaptation, and now we have to think about how to mitigation as well. So lastly, the Health National Adaptation Plan, or HNAP, was endorsed this year. So it's more emphasized on leadership and governance, and in information system, and then upgrading healthcare facility infrastructure, and community engagement. So these guide national policy and investment decisions. So moreover, we are enhancing our capacity to develop climate finance proposals, which including through the Green Climate Fund. So the Ministry of Health collaborates with the Ministry of Agriculture and Environment so attend the coordination meetings with partners to ensure the strategy resource coordination. So intersectoral collaboration is essential. So, and also involving all stakeholders, including the National Design Authority, in strategy development is more important as well. So we know that it is a long-term effort, and we are committed to working with partners to strengthen the resilience of our health system for years to come. So that's all. Thank you.
Thank you so much. Dean, I'd like to turn to you. The Gates Foundation has done a significant analysis to build an investment case for climate adaptation and resilience. Can you talk a little bit about why you prioritized that work and what those core findings were?
Absolutely. Thank you so much, and thank you to Brazil for its leadership on climate and health and keeping this momentum up. There's been kind of a nice effect between COPs with this increased attention to the field, but COPs are sometimes very good at introducing norms and not as good as at implementing them. So the action plan, I think, is a nice form of pressure on all of us to think about the outcomes. And as you said, Manisha, this is it's kind of a bad year to start with. Health cuts, humanitarian cuts, skepticism on mitigation, and the emergence of maybe it's fair to a degree, but it's like a lot of self-interest. What's in it for me? How does this benefit me and my community? I know this isn't really a silver lining, but perversely, climate health is in a pretty good position to answer that question and to be able to explain very directly how action, investment, policy benefits individuals and their own experience with climate impacts. And so from the against this backdrop, from the Gates Foundation side and working with a lot of partners, and I'll hear from Tamara about this as well, we've been looking at what are those areas of health climate action and kind of adaptation more broadly where climate really prevents achievement of outcomes that has really material impacts on livelihoods, and where you can really make that case to individuals and communities about why the investment is important for them and why the policy matters. And it's obviously not a perfect fit, because every city, every family has its own circumstances and they can't be the same, but we are seeing some commonalities, and we call them best buys, others call them breakthroughs or big bets, but it's really those investments, and in our case innovations, in a kind of 3 to 5 year time span that can really allow development goals to be achieved, that have these benefits for livelihoods, and that obviously have climate resilience impacts. And one of the pieces of work that we're most excited about that we're doing with the World Bank is on exemplars. And so a really brilliant team is looking at places where climate disasters have happened and then analyzed why health systems remained functional during some of those disasters, and really to bring out those best practices, those technologies, those policies that allowed resilience to happen. And then the most important part is taking those lessons and integrating them into MDB and philanthropy and other portfolios. So our hope really is to keep pushing toward this conversation about where are the returns, where do the individuals, constituents, when do they have the greatest benefits. And there's maybe two areas that I would really highlight from the Gates portfolio, and obviously this is not an exhaustive list, but something that's been really resonant so far. We brought both of these topics here to the conference, and we'll be mobilizing around them for COP, but it's malaria and maternal and newborn health and mortality. And on malaria, I mean, this one is I think, relatively accepted now that there's a very strong link. We have this public number of 500,000 additional deaths between 2030 and 2050, which is, very compelling. What's also interesting is that 90% of it is not from mosquitoes spreading to new areas, but from floods and from climate impacts that happen really at a local level. So again, kind of back to this story of how does it impact me? How does the climate change my own exposure to malaria? And with that kind of overarching need, there's all these dimensions of an action plan that are emerging, and these are all things that COP30 can help to propel and to bring more resources around, and certainly compel us, the Gates Foundation, to also think about our own investments. And this can be honestly just doing more now because it's easier before climate change gets worse. Early warning systems, integrating nets and insecticides into disaster response kits, and having more flexible finance available for malaria, like for a post-disaster larvicide. The Global Fund has a climate facility. That's another thing that at COP we can rally around. The second area is maternal and newborn health, and our partners at the London School of Hygiene and Tropical Medicine released a report here this week, which is really impressive and also very sad. And just to flag some of the statistics that are in there, in a survey of 29 countries, 1 in 3 of the heat-related neonatal deaths is from climate change. 28 million children underweight over the next 25 years. They did modeling in South Africa and Kenya on child mortality under 3 degrees and 4 degrees. You saw kind of 50% jumps in the mortality rate, even when you include rising incomes and medical advances. And I would add that 60% of maternal and newborn deaths occur in humanitarian settings that are also almost a perfect match for climate fragility. And then they also looked at what do we do as a result? What is that action plan for maternal health? And early warning systems with cash transfer, more investment around diarrhea, health action plans that specifically target these demographics, and more kind of pooling of resources between climate development and humanitarian actors based on where these impacts are happening. And we recently launched with the UAE and a number of other partners the Beginnings Fund, which is meant to really address these gaps in maternal mortality and newborn mortality, and with the climate lens is part of the dimension for that. So just maybe 2 last points on next steps. I think it is really important that with the plan, we really link it to resource mobilization. I think we just come with a plan that won't be enough. We need to show, especially at this time, that there is commitment behind it. And what would help us too is also to have some of these clear landing points at COP, knowing this is what we're leading up to. I think it'd be great to see health in the summit, and to make it clear to leaders that they're expected to communicate to their constituents about what they're doing on these very material impacts. And then from the most of the panel side also, it's coordinating on what we think these best buys and breakthroughs are. Again, they're not going to be the same for everyone. Your best bet might be my bad bet. But in general, there are some trends that we can all mobilize around. So that's kind of where our heads are today, and certainly super optimistic about COP31, or COP30. Also COP31.
Thank you, Dane. I think you did a wonderful job of really anchoring how sort of the climate impacts and the investment case is so interlinked with how we think about public health, as well as how we think about climate action. So that intersection becomes really real when we think about the maternal and child health concept. It comes back to health being an adaptation priority. And as we think, when maybe asking Estefania, from the Adaptation Fund's perspective, as we are seeing sort of these stories and this investment case emerge, how is the adaptation fund thinking about incorporating health into its portfolio? What have you done so far? And where is how is the aperture opening to incorporate some of these new findings and these quote-unquote best buys?
Bom, primeiro de tudo, muito obrigada por me receber aqui hoje. Eu vou tentar ser muito concisa. Eu sei que todos estão cansados. Se eu não cobrir tudo que me foi perguntado e o que tem sido falado aqui, por favor.
Either today or tomorrow. I'll be around all day. But when it comes to your question, I just want to say that the adaptation fund is sector agnostic, meaning that we fund all the sectors. We just need to fund projects that have an adaptation rationale. So when it comes to health, there has been an increased demand for projects in health, especially because we recently accredited WHO as an implementing entity, and as some of you might know, we work mostly with implementing entities. So yeah, there's had been an increase in this type of projects. For example, we just endorsed a pre-concept note from WHO that's on enhancing health systems in Africa. This is for $10 million. And when it comes to our portfolio, 21% of our portfolio is a health portfolio. We have financed 33 projects that have a health component, and this 21% accounts for $260 million. And yes, we are also expecting these type of projects to increase in the future. Governments have been very innovative and very creative in asking for finance for projects that are very well integrated. So yes, this is the perspective of the Adaptation Fund when it comes to health-related projects.
Thank you, Estefania. Maybe I'll stay with you as we think about mechanisms of accessing financing, and we talked about the need of this new investment case, new models. I think you and the Adaptation Fund is an excellent use case. So for the audience who are interested in understanding how to access or how to work with the Adaptation Fund, what guidance can you give them?
Yes, so I was, I brought a slide. I don't know if they can project it now. But yes, we have a couple of funding windows. So we have the regular funding window, which is for single projects, single country projects, and regional projects. And as I mentioned before, we work with implementing entities, accredited implementing entities. There you go. So this is an overview of all of our funding windows. So we have 3 pillars, and also we have readiness grants. I just want to, mention before that all of our funding is grants-based. So as I was saying before, we have the single country project window, and you can see in the second column the accredited entities that can access all the funding windows, and also the maximum amount per funding window. So in the single country, every country can access up to $40 million. So this is the cap that we have right now. We just increased it, by the way, we just increased it in our latest board meeting. And we also have regional projects that can be accessed by regional and multilateral implementing entities. These are up to $30 million. And we also have what we call LLA, which is locally led adaptation. And we also have innovation projects that can be accessed through national implementing entities as well as the other entities. And I would also like to mention that within the Adaptation Fund Climate Innovation Accelerator, this is the window where non-accredited entities can access the Adaptation Fund resources. So there are a couple of windows that can be accessed to these entities that have not been accredited by the Adaptation Fund. And so yeah, basically, this is an overview of what we have. I would also mention that for every concept or a full proposal project, we need to have the endorsement of the governments, and this is basic for us to review all the project proposals. And yes, I would recommend the agencies that are interested in our funds to do a little bit of research in our website and also to reach out in case you have any questions.
Thank you so much. From the Adaptation Fund to the World Bank, so Tamer, you have been a sort of road warrior in the climate and health space for a long time. Let's not say how long, but you know, thinking about all the efforts, including the joint roadmap for climate and health finance and action as part of the development financing institutions, there's a lot of work that the World Bank has done, and your leadership is testament to that. If you think about the last 5 to 10 years and the journey that you and the World Bank has seen in financing health and health at the at the intersection of climate and health, what are learnings that you can share with the community?
Well, thanks so much for the question. First of all, just to thank the government of Brazil, the Ministry of Health for hosting us and for the work that they've been doing in further advancing the focus on solutions for this COP. I want to start off at the beginning by just reminding us why we're here, why we're even having this discussion. And I keep doing that to myself every time I'm in these international forums so that we don't lose sight of why we're doing what we're doing. And it's ultimately, you said at the beginning, it's about people. We know that based on work that we've been doing in estimating the impacts of the climate crisis, we know that nearly 134 million people will be pushed into extreme poverty by 2030. This is only like 4 years away, 5 years away from where we are today. And that a third of that would be because of health-related impacts. We know that the cost, obviously, of the climate crisis, from a health sector perspective, is going to be in the order of about $21 trillion by 2050, and that we also know that the burden of this economic, cost of inaction is going to be falling heavily on particular regions. In this case, Africa and South Asia will be obviously bearing the major brunt of the impacts from the climate crisis, and not to forget that they've contributed the least to the crisis. So we have an imperative, and there is certainly a lot that we need to be able to do, and we need to be able to learn from the lessons, in sort of scaling up. And I want to just very quickly say that it has been a journey for us in the World Bank and a huge evolution over the past 10 years. So let's go back 10 years ago, Manisha. 10 years ago, we were in Paris. Yeah. And that was when the world basically came up with the Paris Agreement, the pledges from so many different sectors, pledges then came into effect so that they could reflect what they would do in terms of their nationally determined contributions. Now, in the World Bank, in 2016, we put together our first climate change action plan. We defined a certain proportion of our overall share of financing that would go towards climate action. And here I'm talking, broadly speaking, on climate, not necessarily on health, but it was a part of that. And that was 28%. We then came up with an updated action plan in 2021 that actually then, put health adaptation at the center of it. And we defined a higher sort of percentage that took us up to 35%. We increased that later on to 45% at COP28. So from health, this is what I can say. We started off with 6%. Back in 2016, our investments, only 6% of whatever we were spending on health systems strengthening operations went into climate action. Last fiscal year, we were up at 49%. So that was already a huge jump in terms of the kind of resources that we're able to bring closer to governments. And that actually translated to nearly about $2.3 billion in terms of investments in this last fiscal year. And this was a part of our evolution. The second part of the evolution, in my view, is what we're seeing here. Yeah, the partnerships that we've been able to build around this agenda. So this is all of us. This is ATACH. This is the Development Bank's Working Group for Climate and Health Finance. This is the Joint Learning Network, where we have brought in 21 countries really to share experiences and to also put in place platforms for sharing learning lessons, if you will, across different localities. But in the last minute or so, I just want to focus the attention on one particular partnership, in this case, the Development Bank's Working Group for Climate and Health Finance. And in specific, since we've been talking about the solutions, I want to be able to talk about the best buys. So we have, in the lead up to COP28, established this working group. And we've defined a roadmap of action to increase and scale up climate finance and action. And 6 pillars made up the content of this roadmap. The one that I want to talk about is how we've been able to focus on country-tailored, evidence-based solutions. And this is where the development banks came together. And by the way, this is not just the multilateral development banks, it's also public development banks. And we have more than 10 development banks as part of this working group. So we came together to really think about what would constitute high-impact, high-value interventions. We've been, I think for the past 2 years, referring to it as the best buys. We're quickly getting to realize we need to be careful in how we word this. So these are high-impact, high-value interventions that can be scaled up at a country level. As Dane was saying, a best buy in one country may not necessarily be a best buy in another. Yeah, and in fact, it may be a bad buy. So we need to be able to understand that localizing and understanding how we take this, down to a country level is going to be important. So through ATACH, we have been leading a specific task team that brings in around 30 institutions that are contributing to this work on the identification of these high-impact, high-value interventions. And we've established an expert group, global expert group. In fact, we just met last week in Heidelberg, where we were discussing, some of the findings from the systematic reviews that have been conducted. And we've identified 15 high-value, high-impact interventions that will be then taken to the next level of actually doing a full a full economic analysis for using a cost-consequence approach. And this is where the exemplars work also comes in, because not everything is out in the peer-reviewed literature. There's a lot that we don't know, and there's a lot that we need to be able to integrate. And the work that we're doing with Gates in this respect makes a lot of sense, because it comes in, looks at the positive deviance in different countries, and then we go back and we say, well, what is it that made these particular examples successful? What sort of health system levers were taken into account? Now, my last point on this is that when doing so, we also need to recognize that there are so many groups doing different, let's say, exercises in relation to this. So we've been successful in getting the disease control priorities group with us as well. And in fact, they're going to be contributing to this. Moving towards COP30, what we're going to be doing is focusing in the first phase on the health system adaptation solutions, if you will, these high-impact, high-value solutions. And in doing so, we're going to be obviously launching together and collectively through ATACH and with other partners what we believe could potentially be the those solutions that we could bring to the forefront.
Thank you, Tamer. Before we go to the UNDP video, a quick follow-up. 2025 is a year of change and it's a dynamic environment. So what looks different from your perspective as you think about the role of the World Bank, changes in approach, if any?
So again, I think this is part of the evolution story. Yeah, we know that countries are obviously, they're under very tight fiscal, environments, and that we need to be able to operate in a way that we bring obviously more resources to those countries. But there's two parts to the story in my view. One part is what we do around domestic resource mobilization and how we work with governments to also ensure that there's prioritization of funding and more sort of resources go towards the health sector. And then there's the other part, which is, well, what do we do as development finance institutions to also be more sort of adept and responding to what's needed? And in my view, in the World Bank, what we've done is the first thing is we said, okay, well, we need to be able to focus on this as a health systems agenda, not to be creating vertical silos. So we don't want to be fragmenting, if you will, the kind of resources that are going into overall health system reforms. That's one. Two, ensuring that we're also doing this, and given now that we're here in Brazil and we've been having discussions around this, ensuring that we're doing this on a livable planet. Yeah, so we've expanded our mission, our vision, to ensure that we're working towards eradicating poverty on a livable planet. Now, at the same time, I think what's important to say is that we've committed ourselves, together with other partners, to reaching 1.5 billion people by 2030 with quality, affordable health services. And I think with a commitment like that's been made last year at the spring meetings, this is about how do we ensure that we do that with climate at the center of this. And I believe that, with these sort of corporate commitments that are being made, obviously aligning, sort of partners around the health systems agenda, that we should be able to push forward on this. If you allow me just 30 seconds on the last point here, because I believe the other thing is also about how do we put in place mechanisms that get us to harmonize across institutions. And to us, this is extremely important. So I want to point to particular platforms that I believe are very important in this case. One is the Global Collaborative Co-Financing Platform. Okay, and this is one that was launched by 10 multilateral development banks to ensure that we're able to identify opportunities, for synergy where co-financing could be applied. And the last one is it's a new facility or a new platform, the Full Mutual Reliance Framework that we've launched with the Asian Development Bank, that actually allows us to be using processes and procedures across any of the institutions if we are in a co-financing arrangement. So governments don't have to go through the burden of using ADB processes and procedures or World Bank. I mean, they make a choice on which one to use.
Thank you, Tamer. The common application form for development banks would be a game changer for countries. With that, we'd love to tee up a video from UNDP's Mandeep Dhaliwal with prepared statements.
Excellencies, distinguished delegates, colleagues, and friends, it's an honor to join you via video here in Brasília, a city that today plays host to a critical step forward for climate and health action. UNDP warmly welcomes the launch of the Belém Action Plan, a landmark initiative led by the Brazil COP30 presidency and WHO. This plan offers a timely and ambitious menu of action across 3 areas: climate-informed surveillance, policy and capacity development, and innovation and infrastructure, all grounded in equity, climate justice, and the needs of the most vulnerable. As the lead of the UN's climate promise, and with a significant portfolio addressing the determinants of health, at UNDP, we are very proud to be working closely with WHO, the Green Climate Fund, and multiple countries to help translate the Belém Action Plan into reality through a new global program, the Climate and Health Co-Investment Facility. This facility is being co-designed and co-developed to support countries in implementing their COP26 health commitments, facilitate their access to finance for climate action in the health sector, and serve ATACH, especially in the area of implementation. Over the past 18 months, we have been hard at work, together with 15 countries, to create an operational roadmap. In 7 countries, we have co-designed investment-ready pilot projects. These include AI-enabled early warning systems, climate-smart infrastructure, and decarbonization of health supply chains. In 8 others, we will be supporting the development of national policy frameworks, evidence bases on climate health risks, and emissions baselines, building the enabling conditions for longer-term country-led transformations. In all 15 countries, together with government partners, we will support the development of strategic climate health investment plans and pipelines. The facility is structured around 3 interconnected financing windows: a grants and technical assistance window to support planning, capacity development, and urgent adaptations, a de-risking window to lower barriers to private sector engagement, and an investment window to catalyze blended finance for climate health infrastructure and systems. Crucially, the facility will embed the 3 strategic pillars of the Belém Action Plan, whether through integrating climate and health surveillance, strengthening institutional capacity, or financing low-carbon health facilities. We are already supporting countries to design and deliver precisely the work that the plan envisions. And yet, financing gaps remain. According to the Rockefeller Foundation's latest analysis, global climate and health financing increased tenfold since 2018 and reached around $7 billion in 2022. Yet, only 9% of climate finance is directed to the health sector, and a significant share of that support comes as loans, not grants. That means many of the countries facing the greatest climate health risks are still unable to access or absorb meaningful investment. This is a matter of political will and strategic alignment. So today, allow me to extend 2 clear invitations. First, to governments. If your country is advancing climate and health commitments but faces implementation barriers, we invite you to engage with us, as we want to know how the co-investment facility can work with you. Second, to donors and development partners. We urge you to co-invest. Country demand is strong. The pilots are ready, and the moment for scale and action, as captured by the Belém Action Plan, is now. We're pleased to share that the Climate and Health Co-Investment Facility program is on track for submission to the Green Climate Fund in the coming months. We look forward to realizing its full potential to support countries in turning commitments into ambitious, coordinated, financed, and scalable action. Together, we can ensure that the next stage of climate finance doesn't just reduce carbon emissions, but protects lives, advances equity, and strengthens the very systems people rely on when they are the most vulnerable. I wish you a very good meeting. Thank you very much for your kind attention.
So let's take Mandeep's call to action here around how we best coalesce around the Belém Health Action Plan, because here we have a framework to really organize ourselves as well as the community towards a more implementation, a solutions focus. That's what the world needs. That's where we need to be headed. So let's start with the country perspective. Maybe a 2-part question for you. First is, from your perspective, what guidance can you give financing partners in terms of how they can support country priorities, especially within the framework of the Belém Plan? And the second part is, from the country perspective again, how are you working with internal stakeholders to unlock domestic financing so that the opportunity and the need of the country is met by a diverse set of resources?
So once again, thank you for the important questions. So as government side, so we think that several key factors can enhance resources mobilization to support country priority aligned with the Belém Health Action Plans. So I do believe that we must focus on several key areas. Like the first area we must focus on is government leadership. So the Ministry of Health is already integrating climate resilience into the national health strategy. So our climate change and health adaptation strategy is feed directly to our health national adaptation plans, which target climate-sensitive health, treat like vector-borne disease and waterborne illness and heat related to condition. So the second key area that we must focus on is global and regional support. So international partners play a key role in both advocacy and technical support. So the Belém Health Action Plan includes strategic direction. So the Ministry of Health focus on strengthening climate resilience and establishing early warning access. So we establishing early warning system for climate change, for climate sensitive disease. And the third key area is joint resources mobilization. So Ministry of Health has successful access the green, we can say fund from the Green Climate Fund and the Global Environment Facility to develop its HNAP. The project aims strengthening climate resilience of the Lao PDR health system, aim to enhance climate resilience and community capacity building in managing health impact from climate change with support from the World Health Organization and the Save the Children. And the fourth one is technical guidance. So technical support is essential for assessing need and designing effective interventions. So WHO support through the GCF Readiness Initiative project build our staff capacity to manage health risks related to climate change. So next is advocacy for country priorities and effective monitoring frameworks are crucial. And finally, the final key area we must focus on is coordination and data sharing. So the government coordinate information sharing as we've seen with the Ministry of Agriculture and Environment's identifications of high-risk district for flood and drought and also for storm that are guiding us to improve in water, sanitation, and infrastructure in healthcare facility. So that is our government perspectives. Thank you.
Thank you. Dean, as we think about sort of how different resources or differentiated capital can be useful, what is the role of philanthropies? I think we're asking to represent a wide suite of philanthropies, including one I work in supporting these efforts. We heard from the country perspective, there is this framework, and how do we lean in and accelerate implementation?
Well, I'll go from the foundation perspective and say research and innovation linked to big budgets. And so maybe just a couple of examples under both of them. On the research side, and I see often that philanthropy can come in and fund things that other people are not interested in because it's too specific or the communities are too low income. Or where there's just kind of a gap in the market that hasn't been addressed yet. Like on the advocacy side, we recently did a study with World Resources Institute, which went through all the MDB portfolios on adaptation and said, where do we see the highest quantified socioeconomic returns? And health was 71%, was like way above the others, and I think health people were also a bit shocked. But that's the kind of proof point that we want in the market and people talking about and thinking about when they're doing their own allocations and certainly when they're applying to MDBs. And then the other part might be more on that kind of lived experience and impact side. And for instance, in the report that was released here at the conference on maternal and newborn health, it underscored that there's really very little research about, what happens to pregnant women and small children in humanitarian settings over, multiple drought and heat wave cycles. There just isn't anything that tells you, okay, this is what happens, to their bodies, to the mortality. That's an area where I think philanthropy can come in and help to fill the gap. And on the innovation side, the foundation's very famously techno-optimist, and what we look is kind of these kind of gaps in the market where we can de-risk that initial investment, and whether that's vaccines or in the climate space, it might be what will come out of the exemplars work, where we can really say, okay, these are the interventions that made a big difference, and then okay, we'll get behind the neonatal supplements that allow for more human resilience in the face of heat. That's the kind of space that I think we'll try to occupy, and to keep connecting that back to the Belém Action Plan and to the COP cycle, and say, okay, here's what we've done in the last year, here's what we're going to do in the next year.
Thank you. And sort of risk capital is an important framework to be present as we think of a broader suite of resources. Coming to the Adaptation Fund, the Adaptation Fund, sits within the commitments of the Paris Agreement. As newer strategic frameworks come online, especially the Belém Action Plan, how can the Adaptation Fund how does it expand its aperture to include and participate and engage in these frameworks?
So the Adaptation Fund recognizes that aligning financing frameworks with strategic global initiatives like the Belém Health Action Plan is not a matter of coherence, but a matter of necessity. And as such, the fund has already taken steps into aligning its financial frameworks with goals such as the Global Goal on Adaptation. This is reflected in our strategic results framework, and also, for example, with the ATACH Alliance, we have endorsed the guiding principles for financing climate and health solutions. And when it comes to our medium-term strategy, we include a dedicated window for innovation and locally led adaptation, as I was mentioning before. And these serve as vehicles for piloting health-focused interventions. And this is in alignment with country priorities and the Belém Health Action Plan action line in innovation and production. So when it comes to the Adaptation Fund, aligning its work with the Belém Health Action Plan is definitely a priority.
Thank you. Tamer, coming to you to close us out. The areas of alignment between the joint roadmap and the Belém Action Plan. Where do you see those alignments, and how do you prioritize those so that we have a common or a unified framework of engagement?
So I believe there's, if we look at the Belém Health Action Plan and the 3 action lines that are being proposed, there's a lot of priority actions that we're already doing, and they make sense, and definitely we need to be pushing forward on those. And in fact, at the World Bank, we've been already doing that. If you come to think about it, surveillance and early, warning systems. If you're thinking about infrastructure, if you're looking at workforce capacity building, if you're considering digital tools, all of those actually were investments that, that were within that envelope that I was talking about, the 2.3 billion. Some country examples on this. Nigeria, I talked about it earlier today, where we have been working on emergency preparedness and response, mechanisms, how we can support that through a swap. It's not just bringing in the World Bank, but it's also bringing in other partners like FCDO, like the Global Financing Facility and CIF. Country like, in the case of Colombia, we came in with a specific focus on targeting, for example, pregnant women through telehealth, time of climate shocks and providing for sort of nutrition programming. I mean, I'm looking obviously at the work that, the people, our colleagues have been doing through the ICANN. So how do we target nutrition programs? And all of that's part of the Belém Health Action Plan. I think one point, though, that, begs itself is what is it that we may still want to consider to incorporate in the Belém Health Action Plan? And in my view, the one big part which really has to get a lot of more emphasis is the private sector. Currently, the plan seems to be quite silent on private sector. I mean, it may be embedded in different parts, but it's not explicitly called out. And the role of the private sector could not be more important, throughout the whole value chain, and the role that they can be playing from an adaptation and mitigation perspective. The other part that I believe also that, perhaps, will require from us to look carefully at it is the financing. And we've been talking about financing. And maybe we need to also, ensure that we're keeping that momentum on financing, that it is part of the action lines that we put forward, as part of the Belém Health Action Plan, and we ensure that we're able to sort of push on some of the innovative financing, instruments and modalities out there. So this is, in some sense, while it is a solutions COP, financing is a part of the solutions, and financing needs to be also integrated in this, and it builds on previous COPs. I want to just end with one last thing, which is, given that you had commented, we need some way of getting to the application, common application across the development banks. And I want to shed light on what we've done in Indonesia, which, honestly speaking, is a fine example of how development banks can come together to really scale up action. This is 4 development banks, the World Bank, the Asian Development Bank, the Asian Infrastructure Investment Bank, as well as the Islamic Development Bank. They came together with a co-financing project, $4 billion, to strengthen primary healthcare, hospitals and laboratories. And it was one of these examples of how you get development banks to work together in a co-financing arrangement. But Nigeria is another example where you could still be going in with a coordinated parallel financing that aligns with country priorities, that you get the countries themselves to be in the driver's seat, and they own, if you will, a program that we all align to. Thank you.
Thank you, Tamer. What we heard this evening was a unified commitment towards moving to a new model of financing, a new model of operating. We have, country leadership showing how we can expand beyond health financing to access climate financing. We have adaptation resourcing that's also opening up apertures and entering into the public health space. We have unique collaborations that the World Bank has shown us are possible and are ready to scale. And we have risk capital that is looking to innovate at the frontiers and ensure that we have new solutions, new evidence, and new proof points that we can bring into this sort of basket of best buys, which are always evolving because we are going to be learning. All of this is under the leadership of COP30 and the Belém Action Plan. And we are all grateful for the leadership, the courage and the creativity that you have shown, because we are hungry for that and ready to galvanize behind that leadership. So with that, I'd love to hand it over to Bruna for closing remarks, and thank you again for this commitment and this leadership.
Thank you so much, and good evening, everyone. First of all, I'd like to say it's an honor for me to be here in this roundtable on behalf of the Ministry of Foreign Affairs of Brazil. And I would like to sincerely thank the Ministry of Health for its vision and commitment in hosting this event, and also all of the panelists that have been part of this session for the extremely rich discussions. Your leadership has been instrumental in placing health at the heart of the climate agenda. I would also like to take this opportunity to recognize the importance of the Belém Health Action Plan, an inspired and pragmatic roadmap for strengthening climate resilience in the health sector. As we have seen in this panel, the plan is not only a national policy proposal, but a bold and coherent contribution to the global climate response. It stands as a concrete example of how to bridge negotiation with action on the ground, a core ambition for a COP30 presidency. At this critical juncture, the world is looking at Belém and to all of us for leadership, clarity, and political resolve. The climate crisis is no longer a distant threat. It is here and is shaping the lives and the health systems alike with disproportionate impacts on those already marginalized. Despite all these signals, adaptation remains underfinanced and in many places underimplemented. It is high time we shifted this reality. It is time to frame the future of the adaptation agenda, starting from key sectors such as the health. Even if all of our resources were directed to mitigation, the world would still need to adapt. Our health systems would still need to adapt. Our women and girls, our people of African descent, which is crucial here in Brazil, people with disabilities, they would still need a closer look into their needs and how climate change impacts their lives and their health. This is why negotiations such as the one on the global goal and adaptation and and initiatives such as the Belém Action Plan matter so much. As we approach COP30, let me share with you some key messages. First of all, the future of the climate regime depends on implementation. We must move from frameworks to delivery. And the action plan is one key opportunity for us to deliver on that. Second, adaptation is a global responsibility. Climate risks are borderless, and so must be our actions. This requires renewed commitments between countries, institutions, and commitments. Third, we must strengthen means of implementation. Throughout the panel, we have seen many existing solutions that are waiting to be scaled up. For that to happen, yes, we need a strong resolution coming from our political leaders, but also from other stakeholders. And I mean MDBs, philanthropies, funds, the private sector, working together and coordinating efforts. We must change the narrative that adaptation costs too much to one that embeds adaptation in all of our actions from now on. In short, adaptation must be visible, viable, and fully resourced. This is the message we would like to convey, and Brazil is paving the way for that to happen, and now we need to know who is with us, who is on board with us in this challenge. To conclude, I would like to thank you very much for the extremely rich discussions that we've seen today, and invite you all to work together so that COP30 in Belém can go beyond negotiation and be a turning point for adaptation, pointing to equity, resilience, and justice. Thank you very much.
Last picture, please. The photographer, who was just beside me right now. Oh, he's there. Senhoras, senhores,
Ladies and gentlemen, thank you for another day of work. Please don't forget to give the translation.
To hand over your translation devices, and we'll see ourselves tomorrow.